the questions as the speaker has ended.
You can start
So the question,
YouTube and recording everything.
Yeah. Bhargav, now we can start, sir.
please go ahead.
So on the behalf of all the organizers, I welcome all the participants as well as the speakers of this evening to this webinar series. And this is one of the most important, after this pandemic situation. See, we all are facing problems due to the COVID situation. So the topic of today's webinar is COVID-19, Omicron, and looming crisis. How to handle. So this is, that whenever we see that, we organize on the behalf of Alumni Association of JNU, we always think about the way forward. So maybe this webinar will be, benefited for many people who are facing this type of crisis in their situation. Many people, is a situation of this type of arose due to COVID-19 pandemic. This is not affecting only the elders and other things. Even children, the old age people, everybody is facing problem. Even I can see, the many of the during the lockdown, even the dogs of my colonies and other, they are also, sort of suffer. So I think this is the crisis situation, and probably we can learn many things from these crises. So this has actually given us opportunity to learn many things. So maybe this type of situation has given this opportunity to interact with all of you and organize this very important webinar of the series, which we are last I think 1.5 years we are conducting for a longer period. So may I request Dr. Dheeraj Kumar Singh to speak. He is the General Secretary of AJ as well as the CEO of the GRC India. So to speak a few words about the webinar. Maybe some problem is there in the.
Sir, one second, sir. One second.
Yeah. Now you are audible.
I'm audible, sir?
Am I audible? You are audible.
Okay. There's some technical glitch. Sorry. Good evening, namaskar, and a very warm welcome to another edition of National Webinar organized by Alumni Association of JNU, BRICS Chambers of Commerce Industry, GRC India, The Policy Times, and SEPC. It is indeed a pleasure for us today that gamut of experienced professionals are available to share their valuable thoughts on the subject. Today, we have amongst us various eminent guest speakers, learned personnel, my respected friends and alumni members associated with this national webinar. My sincere gratitude and thanks to the panel of speakers for giving their kind and taking their valuable time for part of this webinar. The topic for today's webinar is for itself, and we have been dealing with this 2019 till date, and COVID-19 looming crisis, how to handle. To introduce the panel for today's webinar, we have amongst us Dr. GC Khilani ji. He is the chairman of PSRI Institute of Pulmonary and Critical Care and Sleep Medicine, and he is a formerly professor and HOD of Pulmonary Critical Care and Sleep Medicine, AIMS, New Delhi. Padam Shri Dr. TP Lahane ji. He is an ophthalmologist and senior member of COVID Task Force of Maharashtra. Professor Sangeet Ragi ji. He is a professor and head Department of Political Science, Delhi University. Dr. Purushottam Lal ji is the chairman of Metro Group of Hospitals. Dr. Nivedita Gupta ji, head of virology at ICMR. Dr. Neeraj Nischal ji is a professor in Department of Medicine, AIMS, and he is also a part of the COVID task force. Dr. Milnanini Darswal ji is a doctor and IS officer currently pursuing her PhD in Harvard University on public health economics. Dr. Anand Raghunathan ji from Center for Molecular Medicine, JNU. Dr. Sasank Dwivedi ji, he is an astrologer and international religious guru. Sri Bhargav Mitra ji, Counselor, Embassy of India, Tashkent. For today, we have our very own elder brother, Professor Praveen Kumar Verma ji. He is the Director R&D in JNU, who will be moderating this entire webinar. He has been taking the lead on many different fronts in JNU and outside the campus also, and he's a very positive personality. Alumni Association of JNU has always been on alert with respect to the current scenario and any topic of concern. Our team has always been taken up matters diligently and tried to make people aware through whichever ways possible. Having its approximately 80,000 alumni a network spread across the nation, AJ has been constantly contributing to the society in their own ways for the overall betterment in almost all fields of life. The COVID-19 virus has taken many lives till date and has become a monumental crisis even after so much of precautions, lockdown and restrictions. The only thing which can save us from the virus are the safety kit and rules which we all are aware of. After Delta variant, this Omicron has now taken the center stage and creating havoc amongst our society and nation. Various doctors, physicians, scientists having done extensive studies and are coming up with newer ideas on how to curb and control this new variant. And we have seen many successful attempts and even lesser deaths as compared to earlier, which gives us a sigh of relief. But again, if we focus on media reports, there is another new variant knocking the door called New Cough, which is said to be more disastrous than Omicron. As today the world battles the COVID-19 pandemic, about 121 years ago, when another pandemic plague broke out in Kolkata and other parts of India, Swami Vivekananda ji wrote an unique advisory for the Kolkata residents called the Plague Manifesto. The booklet was written in 1898 as soon as the plague broke out in Kolkata. Vivekananda ji emphasized on not panicking, maintaining personal hygiene, and boosting immunity to keep the plague at bay. Almost the same practices emphasized by the public health experts to battle COVID-19 and its variants. I truly believe that self-realization, self-control, more awareness, social distancing, and taking appropriate precautions is the need of the hour. This is the only way we can control the virus from spreading. Thank you. Jai Hind. Over to Praveen Verma, sir.
Thank you, Dr. Dheeraj. Indeed, you have already make a, the जिसको प्रस्तावना कहते हैं हम लोग, पूरे वेबिनार की प्रस्तावना प्रस्तुत की है आपने. So now I would like to invite Dr. Bhargav Mitra ji. So he is our elder brother to speak something about this particular webinar.
One of my wishes of my life has been that I should acquire doctorate, which I have not been able to do. But I'm already honored that Praveenji has made me a doctorate. So I don't mind that, but I'll strive to become a real doctorate, someday. So, gentlemen, and I'm sure the ladies also amongst us, I have been given the onerous task of speaking on behalf of the president of AJ, Shri Rajesh Kumar ji. I take this opportunity to bring to you a couple of important events or nuggets of information about the Alumni Association of JNU. As Dheeraj ji rightly mentioned in his address, that there are more than 80,000 alumni spread all over the world. And many of them have joined many of them are with us, I would say, in times of crisis. And this support especially came to the fore when the world started countering or came face to face with COVID back in early 2020. The role of the Alumni Association of JNU has been exemplary, and I'm speaking without bias. It has risen to the occasion. It has provided quiet relief and succor to many people who have been part of JNU, who have been alumni of this elite university. And the Alumni Association are also being very compassionate about the work that it has done. The well-being of the alumni has been at the heart of ARJ. Each one of us has been trying to do something or the other in our own way. I believe that the ARJ has worked sincerely and expeditiously to save lives. And that's something which has been the cornerstone of our efforts over the period of COVID, which is still continuing. The idea was to save lives. The idea was to provide these opportunities to those who are in distress, to have access to the basic medical facilities like beds, in some cases oxygen, in some cases monetary contribution. It is not that, our alumni, everybody is well off. So there have been difficult times that our alumni and the families have been going through. And we have been alive to the situation. Each one of us has been trying to do something or the other from our side across the board to ensure that our alumni and their families also, they received some kind of support, whatever the Alumni Association of JNU and the alumni in general can do. So I believe that compassion has been at the core of the activities of ARJ, and they have also been manifested by various seminars. And in the seminars also, we have been asking, requesting people for help. Help has come from most surprising quarters. That has enforced our belief in humanity. The ARJ has also made arrangements for people to be transported to hospitals. If there is some need of medicines or other facilities being provided at home, ARJ, with the support of our esteemed and distinguished alumni, they have done that. ARJ has also organized various facilities for stranded laborers. I mean, you would recall that there was a time when the stranded laborers in Delhi, they were in a panic mode. They wanted to go back to their respective places of birth. And those were difficult times, logistically, as well as socially, psychologically, and medically. So the Alumni Association rose to the occasion, started contacting people at various places. And I believe that the alumni have several contacts which they utilize to the full. And whatever the Alumni Association of JNU could do within its powers and within the limited facilities or the resources that it had, or still has, contributed. And I think the alumni, the esteemed alumni of those who contributed in whatever manner possible, there was a drive for contribution, which also fetched money, which was also given to the PM's fund. Apart from that, several facilities were also provided. I mean, those things went a long way to ensure that relief was brought to those who are in need. Blood donation camps, plasma donation camps were done in collaboration with All India Institute of Medical Sciences. And the JNU itself struggled with COVID. Those who are on the campus, they also had a torrid time. So the university also had to keep pace with that. Apart from the university, in this case, also worked in tandem with the Alumni Association, and they worked as a team. And that is something which is a very important aspect. When the nation was struggling and putting its own fight against COVID, the JNU and the Alumni Association, they also thought of a few measures which were important at that time to come to the rescue. And the rescue had to be very quick. In some times, things were running out of hand. And in some cases, yes, lives could not be saved because of various complications which set in. So comorbidity took its toll. But still, that did not deter the ARJ or JNU or our alumni to make that effort, extra effort, and to go to the people, go to our friends with whom we had existed on the campus. Even if we had not existed with the campus with those people, but we had that connect with those students, former students. So I think Aj's contribution has been enormous. And I believe that today's webinar, as we had a brief chat with Dr. Nishchal, and we'll focus on the subject that we are currently discussing, as Praveerji very rightly spelled out. And I understand that, the webinar will facilitate a knowledge about this problem, which has been written on so many occasions in different forms, in different media. But the insight that our panelists have on this subject is not something which is available in public domain. So I would request on behalf of all the listeners and Aj that our panelists, whenever they speak about the issues at hand, they might try to speak about something which is not available in public domain, and maybe a few nuggets of information which will actually enlighten us on how this fight is being pursued by the warriors. You all are warriors in one respect or the other. That is something which should be very important for our audience. So, Praveerji, back to you. Thank you so much, and wishing this webinar great success. Thank you so much.
Thank you, Bhargavji. It's really that you have summed up everything on the behalf of Aj, that what are the activities and everything with what we have done during this pandemic situation, mostly in the first and second wave, the time of what we have done. I still remember that whenever we do have the COVID response team, and the COVID response team, everybody used to get activated whenever we get a message from anybody who's having the whether he's alumni or not alumni, whether he's a member or not member, we have helped everybody. So this has actually created a ethos of the uplifted the ethos of JNU that we all we all are very proud of. So now I would like to invite our treasurer and Krishna ji, so to speak or introduce the subject of this webinar. Krishna ji, unmute.
Thank you, Professor. Good evening and namaskar, respected distinguished guests and President of AJ Rajesh Kumar Singh ji, Dr. Dheeraj Kumar Singh ji, General Secretary of AJ, Vinod Kumar Singh ji, Vice President of AJ, Mahib Singh ji, Convener of Webinar, and Praveen Verma ji, and Bhargav Da, and Madan ji. So today we are discussing such serious issues, and our guests will highlight so many things. Sir, the growing COVID-19 crisis threatens to disproportionately hit developing countries, not only as health crisis in the short term, as a devastating social and economic crisis over the months and years to come. Sir, income losses are expected to exceed in billions and trillions of dollars in developing countries. The compounding the COVID-19 pandemic is a looming debt crisis for low and middle income countries, where a growing debt burden threatens to crowd and social spending for children. In this period, sir, we have learned so many things, and it is based on mostly the three words. It might be jocularly, but we can say that SMS, where we're used to send by mobile. I'll describe what is SMS along, guys. S stands for social distancing. We have learned another thing. S stands for social distancing. M stands for mask, and S stands for again sanitization. Where we know what is social distancing, sir. Most of us call it social distancing, but we can help to think of it physical distancing instead. Social distancing puts some space between people by keeping their distance from others. People infected with the virus are less likely to spread it. Because infected people may have some symptoms, the pandemic taught us that it is best to keep a safe distance from the others. This is especially true for people at high risk of getting COVID-19, such as those with weak immune system or certain medical condition, or for people who are not fully vaccinated amongst COVID-19. This is even more important in areas where many people still are getting infected with the coronavirus. But how can we source? The question again arises, sir. At this juncture, we can discuss. We know that unvaccinated kids stay connected with friends and extended family members through video visits, play dates. If your kids meet friends in person, help them plan a small outdoor get together where they can keep a safe distance from each other, such as doing sidewalks, chalkouts, riding bikes. You can also plan family activities, take a walk or a hike to get out and get active without physical contact. Try to find quiet streets or less well known paths or these outings. It is best not to go places where lots of people gather, especially those with things that lots of kids use, like jungle gyms. More and more people are getting vaccinated against COVID-19. Eventually, unvaccinated kids will be able to socialize as they used to. But for now, it is safest to keep unvaccinated kids distance from others when out in public. Many of our brothers and sisters have survived from this deadly virus infection and apart from the doctors. This COVID-19 virus has taken many lives till date, even after so much particulars, lockdown, and restrictions. The only things which can save us from this virus are safely kit and rules, which we all aware of. We are highly obliged to have amongst us many senior officials, researchers, specialists in the field, and they will guide us about how to control the COVID-19 COVID-19 variant and how we can keep us safe in this pandemic. So now I should conclude. We have come here to listen our guests. So now, Praveen, over to you. Thank you so much.
Thank you, Krishna ji. Indeed, this is my pleasure to invite first speaker of today's evening, Padma Shri Dr. T.P. Lahane. So was professor of ophthalmology, Grant Medical College and Sir J.J. Group of Hospital, Mumbai. And he has been honored Padma Shri in 2008. And he was ex-dean. Hello. He was ex-dean Grant Medical College and member of COVID-19 task force. So, member of COVID-19 pediatric task force also. He was MBBS from Marathwada University, Aurangabad in 1981. And he has done MS in ophthalmology in 1985. Then he joined government service on 17th of May 1985 as a lecturer in Ambajogai district of Bid. So I started, he has started eye camps under the blindness control program from 1985. He worked in all the rural areas of Bid district for 8 years to provide sight to the blind. After that, he worked for 9 months from October 1993 to July 1994 in the newly established government medical college at Dhule. So this is indeed my great pleasure to invite him to give his lecture. Padma Shri Dr. T.P. Lahane.
Thank you, Professor Dr. Praveen. Thank you very much. Thank you, Krishna. Thank you, everybody, for inviting me. And I'm very happy to share a few things about the crisis because I was a director and the nodal officer, a medical education director and nodal officer when in the crisis of the COVID. So now this is the arrival of acute respiratory syndrome, coronavirus pandemic with the beginning from the December 19 at Wuhan, China. And if you see the reported case in the India, it was in the 30th January, it was reported first time in India. And if you see the worldwide, you can see in the December 20, the new cases were 6,46,000 and the average was 6,14,000. You see in the April, it was increased to 896 and 826. You go to the September, it again came down to thousands, which was there in the lakhs. And you come to the May, again it has gone to the lakhs, 366 and 391. And then if you see in the January, again it is increased in the lakhs. So now when this has started, the first, the sequenced Omicron case was reported from Botswana on November 11th, 21, and few days later, another sequenced case was reported from Hong Kong in a traveler from South Africa. Now, if you see this is from the South Africa. If you see the doubling time of this is a different at this different place, and I will show you. It was now the 1.2, 1.3, 1.7 or 1.3. That was the doubling time from the Omicron, Delta, Beta, and D614G. The now see the why we should now see the variants. Can see B1 1529, that is the variant, and here it is a deletion and more than 30 places there is a different things happening. The more worrisome are the 15 muted sites in the receptor binding domain, and these are the enhancing the transmissibility of the Omicron. You see the 3674, 3675 and 76 are the speculated to and innate immune evasion by the compromising the cell's ability to degrade viral components. And here it is affecting the vaccine response, what they say, the experts are saying. One of the 3 target genes is not detected. That is called S gene dropout or S gene target failure, and this test can be therefore be used as a marker for this variant. You see here there is one news. Boosting with the 3rd dose of mRNA vaccine appears to be restore neutralizing activity. So that is neutralizing the activity, and I think that is definitely helping in this situation. It's come to the 3rd wave issues. The world is under the pandemic almost since 2 years. General population is not keen on following the restrictions. Non-COVID work is equally increased and highly contagious variant. Now you see, are we prepared for this? You can see here the maximum population is vaccinated in India. Bed strength is increased. Oxygen facilities are increased and well set, and adequate medicines are available. Now see let the other side of the coin. This is one side what we have seen. The other side is the what we are having is the registered doctors. See, the registered allopaths are 12 lakhs 55,000. That is if you see it comes to near about one in 1300. Now the registered Ayush doctors are 7,88,000, 1 in 825. You come to the registered MD/MS doctors, 3,71,000, 1 in 3,600. So that is what is the manpower as a doctor. See here, if you see the state-wise, you can see in Andhra Pradesh it is near about the 1,02,000 people. You can go to the Goa, it is only 4,000. If you go to the Maharashtra, it is 1,88,000. Go to the Nagaland, 141. Go to the Uttar Pradesh, 84,000. So that is what is the number of the doctors. And if you see number registered doctors, now this is in the 1,000. You can say in 10 it was 827, and if you go to the 20, it has 1255. It means there is a increase of the doctors in this 10 years. Number is more. You see the growth of the population. Go to the 16, it is 132. If you go to this 140, and the number of the doctors is increasing, not equal to the population, but number is very less. So COVID hits healthcare, hundreds of the doctors positive as infection explodes in India. Hundreds of doctors and other medical staffers are infected as India witnessed a massive surge in the COVID cases. This is fueled by the Omicron variant. And if you see the COVID scare in Maharashtra, over 300 doctors test positive in 4 days in Maharashtra when the Omicron has started the infecting. You see the mask, and what I wrote in front is less people. why this is happening? It is not less people, it is a mask less people. It means the people are not understanding that mask is very important. Now, how to handle? Now, here you see the Center of the Disease Control and Prevention, CDC. What CDC is saying? CDC says mask offers protection against all variants. The CDC continues to recommend wearing a mask in public indoor setting in areas of the substantial or high community transmission, regardless of vaccination status. CDC provides advice about masks for the people who want to learn more about what type of mask is right from them, depending on their circumstances. You see the vaccines. The vaccines remains the best public health measure to protect people from COVID-19. The slow transmission and reduces the likelihood of new variant emerging. The COVID-19 vaccines are highly effective at preventing severe illness, hospitalization, and death. Scientists are currently investigating Omicron, including how protected, fully vaccinated people will be against infection, hospitalization, and the death. CDC recommends that every 5 years and older protect themselves from COVID-19 by getting fully vaccinated. CDC recommends that everyone ages 16 years and older get a booster shot after completing their primary COVID-19 vaccination series. Now that vaccination series is different in the different vaccine. Now you are eligible for a booster dose at 5 months after completing Pfizer primary series, 6 months after completing Moderna, 2 months after completing J&J, and individuals age 16 to 17 are only eligible for the Pfizer. So that is what in the different group. And see, the others can also take an advice from the health department. Maximum number of cases in Omicron monitored and can be treated and managed at the home isolation. Stay at the home. And this, what is required in the home is all these things. But yes, CT scan. Now what happens once you are diagnosed, then you are just running for the CT scan. It is not required unless and until some symptoms are there, signs are there. At that time only you can go for the CT scan SOS. Now there is a well-equipped hospitals and which are very well prepared for the future perspective of the patients. Now what is need for infectious disease centers state-wise. Now what is happened? The infectious disease centers are not there, and so when there was the wave started, we were unable to do the test more than 600 tests. Only 600 were possible in Maharashtra, and that time there were only 3 labs. So now we have got the near about 285 labs, and those are now doing more than 3 lakhs tests every day. And these are special diagnostic labs only for the, you can say, the COVID. Research academy, we required it research academy because today we are seeing so many variants are coming and we are unable to do these tests, and it takes near about now 7 days. Now see, now here what we required is a direct communication of the ICMR and hospitals. So what happens? Because of video conferencing, there was a communication between ICMR, government, and everybody. Prepare uniform guidelines were there because of the video conferencing. Understand and grassroots level issues. Because I was sitting in Mumbai, but I was treating the patient who was in Gadchiroli by the same medicine. That was a video conferencing helping because 4 experts were sitting. The case was presented, and after presentation of the case, the treatment was given. So treatment administered in Mumbai and treatment administered in the Gadchiroli was same. So that, and every day we were taking the round, and those patients were serious. Whenever we see those patients are serious, immediately we were talking to them, providing the medicine. And as you were knowing that time, it was difficult because no trains, no these flights. So we were providing the medicine by the ambulances. And this, at that time, we were understanding the grassroots level issues that time, every time, providing the manpower and training, because this was a bigger issue that to provide the manpower, and this manpower was provided from the doctors who were private practitioner. We requested them to join. 4,600 doctors joined. Interns they joined. Third day residents joined. The third day nurses they joined. And those who were the bonded, but the bond was not done, we requested them to rejoin. So 300 people they joined. And so near about 10,000 doctors, they joined within the 1 month. And so the number was nurses up near about, it was 12,000. So now what happens? What is required here is we need a centrally controlled electronic medical record so that we can study. So it should be a doctor friendly, gives access to ICMR for analysis, because we have everything, but analysis is very, very important, and providing every single COVID facility for the country. So that is what is required in the medical record. And another thing required is the research. What we have seen, what is taught to us by the COVID is research. And because every day the treatment was changing and we were monitoring the world. Now we are not monitoring only the India, but we are monitoring the world by the the task force, and that was helping us. And so nursing staff and technical and class 4 and class 3, that was the main issue that time, because to teach them how to protect themselves. So manage work in all the shifts, ICU to pediatric ward and equally in the other wards. And they were trained. See what happens? They were trained for the protective gears for themselves and also management of the dead bodies. So empowerment of the paramedical staff was very, very important, and it is also in the future. And what helped us, who came for the rescue, is the postgraduate doctors. Though the term was completed after that, also their term extended for 6 months. So actual manpower in the medical colleges where the tertiary care, that is ICU patients, were managed, and these were the doctors who helped us. Labs were run shortly by the patho, not only micro, also by the physio PGs. So they were asked to run the labs. Then internal medicine, anesthesia, chest medicine, PG managed ICU under the senior guidance. So they were managing. And the spirit of medicine, post-COVID recovery of all PGs. And once they are recovered, they joined. And I will tell you, the resident doctor were not on strike for near about 21 months, and that is also a record. Otherwise, for few small things, they always go on strike. But this time, they were helping us for managing the situation. And in conclusion, we should learn from our own and others' mistake too. Investment in healthcare facility is very, 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 very important, and that should increase. The GDP for the healthcare should increase. The doctors should be well equipped to deliver the best instead of loaded with paperwork. And the empowerment to the paramedical staff is very important. Thank you very much. Thank you. Thank you, sir.
Thank you. Indeed, this is a great lecture from your side, and a person who has experience in the field, that during this pandemic situation. So we all got benefited. Maybe I can take one question, sir, which has come to the chat box. That is should we worry about neo-COVID proposed by Wuhan scientists? One question has come, sir.
What is the question, sir?
Should we worry about neo-COVID proposed by Wuhan scientists?
No, see,
This question asked by Amrinder Singh.
Okay,
yes,
I know.
Sir, I have done MPhil in social medicine from Jawaharlal University only.
What do you want? What you want?
Sir, I want to know about this neo-COVID, which is proposed by this Wuhan scientist. We have already seen, sir, the thing which they have done in their, lab. Sir, neo-COVID, yesterday it came in news, and it is theoretical. It is actually, it's a theoretical thing.
Yes. Amrinder, that I have read, but that is a theoretical. Yes. I think unless and until there is some clinical application of this is not having much of the importance clinically.
Correct.
Yes, sir, we understand, but problem is this, sir, this is proposed by this Wuhan scientist. So
I know.
I
So
lost
I
my
think
brother in the
when
second
proposed
wave.
by the one scientist, now we should believe that one scientist only gave us this COVID. So I think we will wait till it comes to the, I think the, can say the clinical study, and then I think we can discuss.
Sir, in the second wave, I lost my elder brother. I couldn't do anything in spite of, I have studied public health for so long. Anyway, sir, thank you.
Yeah, I know everybody is worried about this third wave, and maybe the next wave should not be in coming. So I think we all have taken probably the vaccines, and the Indian vaccines are really working well, and the 60 plus now they are getting the booster dose as well. So really, it's a good situation that we have got in at present scenario. Since I am also delivering a lecture today to somewhere else, so I just want to share, if you can see one of my slide here. Okay. Can you see my slide?
Yes, sir, we can see.
Okay, so it's a very interesting, that data which has come recently by and is that published in the recent journal that is called Proceedings of National Academy of Science. So, and it has came from very well reputed institute, Harvard School of Medicine. So the most important thing is that they have done, this large scale genomic studies, which reveals the robust activation of the immune system following the advanced inner engineering meditation retreat. So this is really interesting. So this has just published on 21st of December 2021. So they have applied a comprehensive system biology approach, starting from the whole blood gene expression profiling, which with multi-level bioinformatic analysis to characterize the expression, transcriptional and protein-protein interaction. And what they have got, that is very, very important for with the specific core network, which is advanced 8-day inner engineering retreat programs. This is just a meditation. So with I'm not going to the detail of that, but you just that they have found some near about 220 gene which is directly associated with immune response, including 68 genes which is related to interferon, which is very, very important for the immunity. The most important thing here, you can just get the system biology data, where the meditation has lesser number of more number of this hallmark of this interferon alpha and gamma response genes. However, the mild COVID, you can see less, and in the case of the severe COVID, it is much less. So this is the one thing that that probably has given us a scientific evidence that we can definitely go for the meditation and other things which we can include in our day-to-day life, so that maybe that is going to help in the future. So the next speaker is a very eminent person from Department of Medicine, AIMS. He is the assistant additional professor, Dr. Neeraj Nishal. He did his MBBS and MD medicine from Maulana Azad Medical College, Delhi. And his area of interest is infectious disease with special emphasis on HIV and tuberculosis. Have been playing a key role in patient care, training, research, and public awareness in COVID pandemic. So he is also he is going to give the first-hand information regarding this the management of this COVID pandemic, and what are the problems that we have all faced during this situation, and how to cope up in the future. And his also interest is in the evidence-based guideline development and also socio-demographic studies. He has published near about 100 research papers in international journal. Thank you, sir, for coming to this particular platform. I invite Dr. Nichal he can speak about his lecture.
Yeah. Dr. Praveen, you will excuse me. Huh?
Yeah.
Should I start?
Please start.
Yeah, thank you very much for your kind introduction. Yeah, so last 2 years have been really very challenging for all of us, and especially all the frontline workers, the medical personnel who have been battling this particular pandemic. Uh, when we started with this pandemic, there was a fear of unknown. Nobody knew what to expect. And all we had was that there is some virus which is causing a great havoc in Western countries, especially the European countries. And we have no way to know how to deal with them because a lot of scary stories were coming from European countries, how the medical professionals are dying because of this particular thing. We don't know how to deal with them. Patients are dying. So I will say there was a fear amongst us. It's not that we were not scared of this disease, but at the same time, we had a responsibility to ensure that people around us don't panic, and we had to lead by example. We were lucky in the way that when this pandemic finally arrived in our country, we had some insight based on the experience of other countries which they have faced, and I will say we were slightly better prepared than what they were. So what this pandemic taught us, I know everybody talks about CDC and what guidelines they are making, but at the same time, I must say that our country was much better prepared because of the experience which we learned from their oversight, insight, whatever you can say. It was a mixture of that, and that's why even if somebody says that we have not done well as far as management of this pandemic is concerned, but from ground level, I can always assure you that this was the best we could have done in the current scenario, specifically when we all know that the healthcare infrastructure of country is not at par with what Western world has. So what this pandemic has taught us is West is not always the best. All we need is to have faith in our system, and of course we can deliver. And this is what this pandemic has proven time again. So I will discuss about the. Is my screen visible?
Yes, yes, it is visible. Yes.
Yes.
So sorry, am I audible?
Yeah. Please.
So this WebEx is slightly cumbersome than other platforms. So
Yeah, sharing is a difficult in WebEx.
yes, fine, okay. So yeah. So this first was described from Wuhan, and of course somebody was talking about virus again. So all I will say, there are lot many virus and bacteria lurking around us, which have not been infecting humans so far, but have potential to do so, and that could be catastrophic. So if we start publishing every virus, the potential virus, then of course people are going to get scared that the way this neocov has created, because it's just a hypothetical situation. There is a virus which infect animals, which has potential to infect human beings, though there is no reported cases as such. And whenever some virus is described to have a high mortality amongst individuals, then rest assured it's very unlikely that it will take a pandemic situation like what this COVID-19 has done. So even if it comes, this will not be of this magnitude. Of course, we have to have a very clear insight about what is happening. One of the biggest problems with this pandemic has been whatever is being published, whether it's peer reviewed or not, it finds a place in the mainstream media, and from there it is amplified as if the world is going to end very next day, which is not the case. So we are in fact fighting another pandemic within pandemic, and that is regarding this information pandemic, which is half cooked. Whatever the reporters feel, they publish without actually verifying facts, and that creates problems. So NeoCov2 is a prime example of that particular scaremongering, I will say, which is happening. It has been published as a preprint which has not been peer reviewed. And the whole context is different from what is being projected. So it should not be. So coming to the main topic. So once this virus emerged, initially they were okay, there is nothing to worry about. But finally, when it started afflicting people across the globe, that is when everybody started realizing the threat. And by the time they realized, it had taken a pandemic proportion. So the first variant was first described from Hubei province, China, and then the most notorious variant, which was the cause of the second wave, which we saw last year, which actually most of us were affected in one or the other way. We have a story to tell about. Each one of us has a story to tell about what happened to them during that particular pandemic. And as a doctor, that was the worst situation I could have been, when I was flooded with requests, but there was nothing I could do in terms of providing beds to the patient, apart from whatever uh, treatment aspect I could dictate them on phone, but there was nothing more than that I could do in majority of them. That was the state during that second wave. And then again, the third variant, this Omicron, which was described from South Africa, and luckily this is something which has spared us, I will say, without causing too much problem. So the question arises, why so many waves? So this virus was a novel virus. Most of us were, in fact, none of us had immunity against this virus. So whosoever will be exposed will have to mount immune response to this particular virus. Now, this virus, when first came, it had its own problem, and this virus don't have the proofreading mechanism. So whenever they are going to replicate, they will accumulate some sort of mutations which may be deleterious to the virus or may give them to a survival advantage. So we all know the Darwinian theory of survival of the fittest. This virus, of course, is trying to survive. So whatever mutation will give it a survival advantage will be selected, and that is what is happening. So this particular Omicron, it is very infectious, more infectious than whatever previous variant had. But at the same time, it's not causing that much damage as the previous variants were doing. So this is what is desirable in the virus, because the virus is smart enough to know that if it kills the host, then it's not going to survive. It needs human host to survive. And that is what it's trying to do, coexist with the human host. So it will become what we are expecting, that the variant will gradually become more and more infectious, but at the same time, it's not going to harm the host. So maybe this Omicron is in that fitting into that pattern. But again, this virus is throwing more challenges than what we anticipated. So it's too early to say, okay, this is the situation which is going to happen. So this was the chronology of the various variants which we have seen so far. And Omicron is spreading very easily, but not causing much of it. So is this the only reason why we are seeing multiple waves? Well, there's one more thing we have to take care of, and that is mutation in human behavior. We all know that this virus cannot survive outside our body. So once we stop following all the COVID appropriate behavior we have been talking about, then of course we are going to give this virus our body to experiment and create more and more variants. And that is what is happening. If this virus is replicating, there will always a chance for a mutation to arise and a potential to cause harm. So the most important thing, according to me, is the mutation in human behavior, which is in this particular way. So the virus behavior cannot be controlled, but of course our behavior can definitely be controlled, and we have to be part of the solution rather than the problem. So we have to ensure that whatever guidance is being given, everybody is aware that COVID appropriate behavior is the best way against all variant of this virus. And if we follow, of course, we can save ourselves and people around us. That is what it expected from everyone. So again, the previous speaker has discussed, okay, there are numerous mutation in the new Omicron variant, and most of them is in the spike protein, which actually helps it to evade our immune response. Spike protein is something through which it binds to the receptor and enters the human host cell. So what the animal models have shown that this particular virus multiplies twice as fast in upper respiratory tract. That is what we call as the larynx, pharynx, and the upper part of bronchus. So that is the part where this particular virus multiplies fast. But at the same time, it spares lung as compared to the previous versions. So this is causing milder symptoms and disease. But again, it has high transmissibility. So this is just a preprint study from Hong Kong, which showed that this virus multiplies 70 times more in upper respiratory tract, and at the same time the lungs are affected 10 times lesser as compared to the previous variants. So its incubation period is lesser than the other variants, and it's around 3 days. So doubling time is again faster as compared to other variants. So it's approximately 1.5 days. So this was the graph regarding the various waves, which the Omicron was described from South Africa, which clearly showed that the spike was very high, but this did not materialize into number of admissions, death, as can be seen in the other variants. So admission rate was less than 50 to 70% as compared to previous infections. And patients were not presenting to emergency as they were doing in the previous waves. Severity of disease was again lesser as compared to the previous variants. So this is an important graph which shows clearly, if you see the red graph is death, the green one is cases, and the blue one is for admissions. So this particular wave was the previous waves where death, admissions, and the cases, they were almost going hand to hand. But in this particular Omicron wave, so if you see the cases and admissions and death, the graph is not coinciding with it. Number of deaths is much lesser as compared to number of cases, which is a good sign. So should we consider Omicron a boom or a bane? So of course, whatever we have the data at the moment, because we are almost 1 month into the waves and we are still to see cases being admitted purely because of COVID pneumonia. Whatever patients we have at AIIMS right now, majority of them, in fact, more than 96% of them are because of their comorbidities. They are sick because of their comorbidities, and they are just because they are COVID positive, they have been put into a COVID center. So the primary problem is not COVID here. The primary problem is their comorbidity, which they had presented to the hospital. And the comorbidities is not being exacerbated by this infection. That should also be clear. At least I'm talking about AIIMS Delhi, where I am working and I'm looking after the COVID patients. So there was worry that even though the number of hospitalization was less, but if the number is very high and even a very small fraction of people actually require hospitalization, that it may overwhelm hospital system. But luckily, 1 month into this wave, all those doubt and fear have proved wrong, which I will say is a good thing. It's not a bad thing, because we have to be better prepared. The way we got caught off guard during second wave was very, very, I will say, difficult for all of us. So this is about the pandemic. So if you see, this was the initial wave, the first wave, this was the second wave, and this was the third wave. So number of cases is almost equal or more than the peak of the second wave. What is important, that the number of death is much less than what it was in the previous wave, which is very important and encouraging sign. So if we compare the same peak, then the number of death in 2022 was 662 as compared to 4,334 in the second wave of 2021, which is an encouraging sign. So what are the symptoms which can be used to differentiate between Omicron versus Delta, or what are the different things which we are observing? So if you see, we are seeing a lot of patients with sore throat, tiredness, headache, aches, and pains. So again, all the gamut of symptoms can happen. It's not that Omicron is different in that term, but definitely these are the symptoms which are seen quite frequently with our patients. Apart from that, patients are complaining of chills, night sweats, and burning eyes. So initially in Delta waves, loss of taste or smell was more frequently described, which is not that frequent in this particular Omicron wave. So sore throat and body aches and pains and fever, this is something which is more frequently described. And of course, night sweats I talked about, apart from nausea, appetite loss, this can happen with these patients. So what we have learned that now we are much informed about this particular pandemic. So we should not be panicking, and we should basically try to stay safe. How to stay safe? The most important thing, we should be aware how this particular infection spreads. So the role of, again, droplets and aerosol is both described clearly. And that's why it's important that the ventilation in whatever room you are, that should be perfect. So that will help, especially when the aerosols are the primary, a very important cause of spread of infection. So we are focusing on now on good ventilation, apart from, of course, the normal COVID appropriate behavior we have been talking about, that is physical distancing, mask, and hand hygiene. So this is the common mode of transmission which has been described, which we all us are aware now. So again, we have to ensure that we keep our hands clean, and whenever we touch an object or a surface which may have been touched by somebody else or somebody unknown, then definitely we should sanitize our hand. That's very important. If we cough or sneeze on our hands, of course, we will have to sanitize our hand. Otherwise, if we are infected, we may actually transfer this infection to others as well. So in both the situation, you should sanitize your hand. Do not rub your eyes. Do not touch your nose or mouth without any reason or with dirty hands. That's very important. Whenever you cough, please do use handkerchief wherever feasible. If you don't have handkerchief, always use bent of your arm to cover your sneeze or cough. Because if you use your hand, then of course this will get dirty, and if you touch some other surface or somebody else's hand, then you might be transmitting that infection. So if you use the bent of your arm, of course this surface will protect it from spreading, and at the same time your hands will not be contaminated. And in case if you use your hand to cover your cough or sneeze, then of course you'll have to sanitize your hand. That's very important. So again, we have to choose a mask which is comfortable for us, and of course we have advocated the use of cloth masks. So if we are not going in a high risk zone, definitely cloth masks are more than effective. But if you are supposed to take care of your somebody who is sick, then of course N95 is always desirable. That is something which we should use. And if N95 is not available with you, then try to use at least double mask. That is very important. And of course, just wearing mask is not going to help. How you wear your mask, that is again very important. So if you don't use your mask properly, then mask is not going to protect you, even if you are using the best of mask. So we always advise wear mask in such a way that it covers your nose and mouth, and the gap by the side of your mask should not be there. It should be properly fitting. So whatever mask you use, unless you use it properly, it's not going to protect you. That should be kept into mind. So again, like the secretary said, the term social distancing is something which should have been actually physical distancing. Because if we say social distancing, then the society, the role of society that which we live in, that may be actually like we saw early in the part of pandemic, how people were being stigmatized if they turned positive. So that social distancing actually encompassed that particular thing. So the better thing would be to use physical distancing, and of course you have to take care of people around you. So saying social distancing is something which I like to avoid, but yeah, this is the term which is being used. Of course, try to avoid any crowded place wherever possible, as long as this pandemic is ongoing. Try to not shake hands with others wherever feasible. Use namaste if you want to greet somebody. That is something which our culture has always been encouraging. So again, it's time to go back to namaste. Golden rule of one of the previous speakers said, Vivekanand has already said this thing way back in 1898 about the role of hygiene, which was emphasized further by Mahatma Gandhi. So this still holds true in this pandemic. So you'll have to keep your surroundings neat and clean if you want to stay healthy. Stay positive. Avoid alarmist news. Like one of the listeners raised this question about new cove. Again, that is something, and I will say it's an alarmist news at the moment because we have no evidence whatsoever to worry about those particular needs. And again, the previous speaker also talked about the meditation, role of meditation in increasing our immune response. So again, if you adopt a healthy lifestyle, healthy eating habits, doing exercise in your daily life, then definitely this is going to boost your immune response. Trust me, there are no immune booster in terms of medicine which we can prescribe and your immunity will improve. So these healthy lifestyle will actually boost your immune response. This is something we should try to incorporate in our daily life. So what if I am positive? What should be done? So the important thing is to stay positive, not in terms of RT-PCR or rapid antigen test, but positive in terms of your mental state. So more than 80% cases are asymptomatic. You will, in fact, in Omicron, it may be more than 90%. In fact, majority of you will not feel anything. And we have to remember that even if you are symptomatic, you are not going to develop, majority of you are not going to develop any breathing difficulty or severe disease. So that is something we should be we should be knowing. So that should not create panic in our mind. So majority of Omicron cases can be managed at home because the severity of this disease, what we have seen is very less. And majority of patients are being managed at home through teleconsultation. So whenever you have an infected person and others are not infected, then always prepare a separate room, preferably with natural ventilation wherever possible. Select somebody healthy in your house who does not have comorbidities and can take all COVID appropriate care and can take care of the infected person. That is again important. All the things used by that infected person should be separate from your household. So especially the elderly patients or those with comorbidities, you have to monitor them quite closely and you have to be in contact with the doctor. So you have to stay in contact with the doctor. And if there is any deterioration in symptoms of the patient, you will have to consult a doctor for that. Whatever comorbidity the patient has, you will have to continue with all the medication in consultation with your physician. Saline gargles may help in throat congestion. Now, and of course, steam can help in if you have blocked nose or the sinuses is causing problem. They can give you symptomatic relief. There have been social media messages going around that following these will protect you from getting this infection, and there is no evidence whatsoever to support that particular message circulating. So steam and gargles will help you in symptomatic relief, not in preventing you from getting this infection. So majority of patients can be managed with 3 Ps, that is patience. Of course, you are going to take 5 to 7 days. There is nothing that can be done before that. Positivity of mind and paracetamol. So if you have fever, take paracetamol. If you have body ache, too much body ache, take paracetamol. That will take care of that. In some situation, the patient fever may persist for prolonged days. In that situation, if you are planning to take some other medication, always consult a doctor before taking any medicine. The symptomatic relief in the terms of anti-allergic like cetirizine, levocetirizine, or cough syrup may be prescribed in consultation with the doctor with whom you are in touch with. So again, majority of patients are not going to require any investigation, something which we saw during second wave when everybody was running for tests. So please do not run after test because you may get yourself tested. Reports may be slightly up and down, and again, you will be in a fix what to do with that. And the most, I will say, misused test was CT scan and D-dimer. Most of people didn't know how to interpret, how to react to whatever findings are there, and that led to a lot of, I will say, inappropriate use of various therapies which should not have been done. So again, please do not run after test unless you have specific indication for getting yourself tested as per your doctor. And again, another thing that created panic was the pulse oximeter. If you don't take it properly, it will cause problem. So always test using one reliable finger, one finger only. If you keep on changing your fingers, because it depends on the blood supply of your peripheries. So if for any reason, if your hands are cold, if you have not made them warm, then this pulse oximeter can give erroneous reading. If you are a female using nail polish, then again this pulse oximeter can give false reading. So always ensure that you have taken this pulse oxygen saturation properly with your pulse oximeter before thinking, okay, no, something is wrong with me. So you have to prepare a monitoring chart, and in case if the patient has any difficulty in breathing or the saturation has gone down, if there is some symptom which is causing problem in the patient like persistent pain or pressure in the chest, mental confusion or inability to arouse, especially in elderly, if there is persisting or worsening of symptoms beyond 3-4 days, these are indication when you should seek hospital admission in consultation with your doctor. When to discontinue home isolation? Of course, at least 7 days have passed from the onset of symptoms. In case if the person was asymptomatic and was detected by chance, then of course 7 days from the date of sampling. And the person should be afebrile for last 3 days. Then one can come out of isolation, but we always encourage these people to continue following COVID appropriate behavior. There is no need for a test of cure, because most of us would like to get another RT-PCR just to see if we have got cured of that. See, RT-PCR can stay positive because it's only picking the RNA of this particular virus. It's like, say, the tree is gone, but the test is is picking up the leaves, the dead leaves, which may be lying there. So that's why we never ask to repeat RT-PCR, because that can stay positive for 3 to 4 weeks even. So at the moment, no need of test of cure after ending the isolation. Post-COVID complications, of course, this is something which we have been hearing in various media outlets. Of course, majority of patients will recover without any problem, but some people may have prolonged symptoms, which may be seen in up to 10 to 12%. This was specifically more frequent in the previous waves. During Omicron waves, it's too early to say how these patients are going to have, whether they are going to have post-COVID symptoms or not. It's too early to say, but data suggests that these are not as severe as we saw during second wave. So this could have multiple causes, and majority of them basically recovered with time. So in one of the studies, 80% of individuals with confirmed COVID-19 continue to have at least one overall effect beyond 2 weeks. So various risk factors that have been identified for long COVID includes initial disease severity, if there were more than 5 initial symptoms, and females predominantly had higher possibility of having post-COVID, long COVID symptoms. So it could affect any of the system. The symptoms could be because of involvement or persistence of symptom in any of the organ system. So it could be because of the long-term tissue damage. This was seen more in patients who required ICU care, went on ventilators, and those with mild or moderate severity, it could be a manifestation of unresolved low-grade inflammation which may be persisting beyond certain period. So for lung-related problem, lung rehabilitation in terms of physiotherapy, your spirometry, that help a lot. Of course, we have to treat the comorbidities, whether it's diabetes, and of course, mucormycosis was something which we saw in I will say a larger proportion of patients than previous waves after second wave. That was attributed to the misuse of steroids, but sometimes we had patients who had no history of taking steroids, even they developed mucormycosis. So this is still an unresolved issue, but what we believe was the misuse of the immunosuppressant, which led to increased spurt of mucormycosis after second wave. And of course, general measures including peer support group, eating healthy, having healthy lifestyle in terms of physical activity, that will definitely help in post-COVID management. Most people will recover within 1 or 2 weeks without needing medical treatment. But again, those who have unresolved symptoms, they can have a peer support system should take help of their doctor. That is again very important. But of course, we have two type of patients whom we know the time will be the biggest healer in such patients. We try to counsel them. All you need is supportive care and counseling. But unless you prescribe them multivitamins or immunity boosters, they are not going to get well. So they anticipate magic pills from you. But all of these patients, majority of them will improve with time. You don't have to do much for them, apart from, of course, counseling and telling them that everything will be fine. So again, stress was something which was seen with increased frequency during COVID-19. This could be related to your workplace anxiety because of the household problems where majority of people were working at home, or because of the insecurity of your jobs and various aspects. So if somebody around you was feeling irritated, was lacking motivation, feeling tired or overwhelmed or burnt out, so this should not be taken as that that person is shirking from work or having some difficulty. It could simply be sign of stress or anxiety or depression. So such people should be given confidence and should be encouraged to seek medical help. That is very important. Vaccinations remains the mainstay of our preventive strategy. We are lucky to have a free vaccination program in our country, and that actually helps in deciding that helps in preventing our chances of getting infection. That is very important. So we have allowed vaccination for children, people above 15 years of age. So all I will say, don't Google, just take your shot without waiting for that magic vaccine, which everybody thinking is going to protect them 100% chances. So our country have been leading as far as number of doses administered. Only I think China is ahead of us as far as number of doses is concerned. But the biggest problem with India and China is their population size. So approximately 49 to 50% of the population of India have received both doses, and 67% of them have received at least a single dose, which is a huge number. I will say, we are fighting within another pandemic, which is infodemic. This is something which is very important for all of us to realize, that we should not be part of this particular pandemic. Avoid misinformation about COVID-19 in social media. Gather information from official sources like WHO, ICMR, AIMS COVID, and AIMS COVID portal, or any institute of repute. So if you see any COVID-related misinformation, please do not engage. Message privately, okay, whatever you are messaging may not be true. You have to check the facts. And if they don't listen, of course, you have to report such misinformation. And of course, we have to remember, whenever we receive a message which says, okay, this is a very important message and you should share it with everyone because this can save life. Trust me, none of the official or path-breaking messages will come to you via WhatsApp. It will be through press releases from reputed institutes. That's very important. So please be a barrier and not carrier of this misinformation pandemic. That is very important. So just I will conclude. What is dangerous is not evolve. This is a statement by Jeff Bezos, and we have to evolve as the virus is evolving. That is very important. Majority of Omicron cases are expected to be mild. Home isolation, symptomatic management, and monitoring to be encouraged, because majority of patients will require this only. Break the chain in terms of physical distancing, mask, hand washing, and vaccination. Definitely, they will save lives. Be aware of infodemic, because ignorance is not bliss anymore. And of course, we have to learn with the virus, and that is to respect this virus in terms of COVID appropriate behavior and vaccination. Thank you.
Thank you, Dr. Nischal. This is really indeed a very, very informative talk. Meanwhile, Professor Sangeet Ragi and Professor Khilani has joined with the two speakers of today's evening with us. So I welcome all of you on the behalf of the organizing committee. So first of all, I would like to. There are so many questions with Dr. Nischal. So maybe we can discuss in the end, or we can discuss right now if you have. So there are a few questions like that. I think.
Sorry, Praveen sir, we can have Professor Khilani sir because
Yeah. Sure.
somewhere. No?
Sure.
So please
So
go. After that, we can have question answer
yeah,
session.
we will have, the
I'm sorry,
discussion.
sir. Please,
Yeah.
We'll have
So.
question after his speech, sir.
So next speaker, is indeed my pleasure to invite such a renowned person from our vicinity, Dr. GC Khilani. He is a professor of pulmonary medicine and sleep disorders from All India Institute of Medical Sciences, New Delhi. And he is presently a chairman of Institute of Pulmonary Critical Care and Sleep Medicine, PSRI Hospital and Research Institute, New Delhi. And formerly, he was a professor and head of Department of Pulmonary Critical Care and Sleep Medicine at All India Institute of Medical Sciences. His contributions in this field has many facets. He has trained entire generation of young doctors in the field of, and he has mentored students from DM course at AIMS. He has done quite a large research, the publication that he has made near about 250 papers. And his research interest has been air pollution, non-invasive ventilation, and ICU infections. So may I invite Dr. Khilani, please.
So sorry, I don't have any organized presentation.
Yeah, please, you go ahead. You can.
My apologies for joining late, and I heard part of the elegant lecture by Dr. Nischal. So I don't know what has been covered, but if I have a few minutes, I'll like to say a few words about the current wave, which is third wave, you can call it, and everybody knows, everybody knows that this is a less severe disease. It's a mild disease. So I will restrict my comments to the practical aspects as to what one should do if you have a COVID case at home. So I'll pick up few points and talk about them. First thing about the diagnosis. The RT-PCR continues to be the gold standard for diagnosis of Omicron infection also. And although there are claims that we are going to have a RT-PCR which will give us an indication or which will diagnose that it is Omicron or not Omicron based on the S gene deletion, but that has not been seen the light of the day till now. So today, if somebody has got fever and is diagnosed with COVID infection, either by RT-PCR or by home testing, then it is not possible to discriminate between Omicron or non-Omicron, which is actually very important because Omicron essentially causes mild disease, especially in immunocompetent people. Another thing which I would like to emphasize that if the home test is positive, what is called as RAT test, rapid antigen test, which gives immediate result, it does not require confirmation by RT-PCR. It should be taken as positive. Because the Canadian study, which was published about 15 days back, which had more than 9 lakh rapid antigen test or home test, you can call it, it showed that false positivity was to the tune of 0.015%, meaning thereby once positive means positive. So the third thing is if there are 6 members in the family and 5 of them are having symptoms, mild symptoms, if the one is tested positive, it may be worthwhile not chasing the RT-PCR test for rest of the people because in the current situation, it should be considered the rest are also having COVID infection and do not burden the laboratories with the test. This is my personal opinion. Now coming to the managing in current situation, because I am a clinician basically and I do see a lot of patients online, of course, and also I have patients admitted in my ICU at PSRI hospital, also in the ward. So it's not that everybody has mild illness in today's era. Nobody comes with the writing on his face that he has got Omicron infection. And as per the data, the Omicron infection is there up to about, say, 90% of patients. 10% still is likely to have some other variant which has potential to cause serious disease. Even Omicron can, as per the South African data, can cause serious disease in people who have comorbidities, I'm sure, which has been described from elderly to diabetics to hypertensive to transplant patient to kidney disease, liver disease, and so on, and those with the cancer and chemotherapy. So at the outset, one has to realize, does this person has comorbidities once he is tested positive? If he doesn't have comorbidities, he stays at home under isolation as told for a period of 7 days and takes paracetamol, cough syrup, whatever, steam inhalation. But those who have comorbidities have potential to cause serious disease and deaths. And believe me, deaths are still occurring in India to the tune of 300, 400 per day. US is still struggling with 1,000 to 1,800 deaths every day, even in this era. So therefore, we have to recognize which are the patients who require special treatment, and these are the ones which I have described. And for them, there are two kinds of therapy. I must emphasize that the previous treatments which we used to give, like hydroxychloroquine or ivermectin or azithromycin or doxycycline or favipiravir, none of them have stood the test of time. The randomized trials conducted with these drugs have shown that they have no benefit. So I get a lot of patients who take a whole lot of medicines and ultimately come with the side effects. And I must emphasize that it has no effect. The drugs which have been found to be effective are two. One is monoclonal antibodies, popularly called as cocktail antibodies. Second is the antiviral drugs, which is remdesivir and molnupiravir. And I'm sure all of you know about molnupiravir because it is talk of the town. I must emphasize that it reduces the severity to the tune of 30%. That means that there is 30% benefit in disease continuing to be mild. And in this particular trial, the number of deaths were 9 against 1. The 9 in the placebo group and 1 in the molnupiravir group. But this study was conducted in unvaccinated people. One. Second is that all these patients had at least one comorbidities. So, and molnupiravir is not good for, must not be given to the people who are pregnant or less than 18 years of age or lactating or wanting to become pregnant in next three months or so because it has a mutagenic effect. So summarizing it, that it is a good drug. There is a trial which has shown convincing benefit. So it can be used under supervision of a physician. Never take molnupiravir on your own. Another antiviral drug which has been used since the first wave, that is remdesivir, which was used for serious cases only. But now the one study has shown that if you give remdesivir in a person who has got comorbidities within 5 days, the efficacy of reducing the severity is 86%. So it is much more than molnupiravir. But remdesivir is expensive. It has to be given in hospital setting by intravenous drugs. You have to ensure that person does not have serious kidney disease. And it is impractical to give it in the community. I am aware of the hospitals in some states, like even in Jaipur, where I come from, that people are giving remdesivir, calling them every day to the hospital, giving remdesivir and sending them back. I have a serious objection to that because you are actually enhancing the transmission, because the patient will go with somebody in a car or a taxi or a public transport, wait in the hospital, come back. So remdesivir should be given in hospital setting. About the monoclonal antibodies, they are very effective against Delta variant because they were tested against Delta variant. The currently available monoclonal antibodies, which is a combination of two antibodies, casirivimab and imdesivimab, popularly called as Regeneron or Regencov, is not effective against Omicron. So therefore, although there are other monoclonal antibodies, several of them, one of them is sotrivimab, which is not available in India, which is effective. If it comes, then it should be given to the people who have comorbidities. But I must tell you that these antibodies under the trial condition were tested in people who did not have antibodies. That means first they tested that the patient does not have antibodies against COVID, and now then it was given. Now currently in India, as per the Sero survey of June-July 2021, 67% of the population, including the urban and the district and the rural area, had seropositivity, and subsequently a whole lot of people are vaccinated. More than 90% adults have at least one vaccine, one dose of vaccine. 50%, approximately 50% of the total population is vaccinated. So therefore, use of this monoclonal antibodies is not much in the current setting till the time we have a test which at the outset will tell us whether it's Omicron or non-Omicron. About the long COVID, Dr. Nischal has just spoken about it. We had very, very large number of patients who had lung fibrosis, who had fatigue, who had continuing feeling unwell, chronic cough, and so on and so forth. Whatever little experience we have with Omicron in last 4 weeks that I am seeing, these people have a short duration of illness of 3 to 4 days. Their sore throat, scratchy throat, stuffy nose, running nose, cough continues for a few weeks that I am seeing. There is no patient with complete loss of smell and taste. That means the neurological system is not affected. We haven't seen too many patients with, any patient who developed any cardiac involvement or the neurological involvement. But we don't have to be complacent. Any patient who has fever is running beyond 4th or 5th day, moderate or high grade documented fever, should be investigated with blood investigation like CBC, CRP, D-dimer, ferritin, and IL-6. If the person comes into that high risk category, and if he is having a lot of cough, then a CT scan is also warranted to assess the severity. So summarizing it, that the focus of treatment of COVID has come down from treating severe illness, where we have reached a plateau as far as the strategies are concerned, to reducing the severity of disease so that nobody reaches the ICU, in which early diagnosis and the treatment with antiviral drug and or antibodies. Antibodies or antiviral are not replacement for each other. It is possible to give both the treatments to a patient. This will go a long way in preventing severe disease. There's a great role of vaccination in controlling this pandemic. This is what I think. And there's a scientific evidence that Omicron infection gives robust immunity. The vaccination gives definite protection against infection against Omicron and also minimizes the severity. United States, majority of deaths are occurring in people who are unvaccinated. As we are aware, the 25% of US population are anti-vaccine lobby, which unfortunately India does not have. So there's a need to enhance vaccination. Other thing is the third dose or precautionary dose or the booster dose enhances immunity. The fourth thing is that vaccination followed by natural infection gives the best immunity. So India is in a position of advantage in the sense that we are vaccinated. We are getting Omicron infection, which is whether it is detected or not detected, diagnosed or undiagnosed. It it is one of the phrases going around, whosoever is breathes will get Omicron because it is so contagious. So combining these two, we are going to have a robust immunity against COVID infection. And what I hope, being an optimistic person, few months down the line, we may reach a stage of endemicity. Now, endemicity is the one like we have in chickenpox or measles. This is a transmission at the low rate, but which is almost fixed, and it doesn't come in the form of the outbreak. So, as an optimistic person, who has seen this COVID tally or rally for last 2 years and followed it very closely, I think in 2-3 months down the line, we'll be cruising, and the life will come back to normal. Thank you very much.
Thank you, Dr. Kilani, for such a informative as well as encouraging things which we all wanted to listen from you, that nothing will move further in this particular situation. So the next speaker is Professor Sangeet Ragi, and you all know probably him for his the participation in various debates in the television, and he is the, if you I can read his profile. He is from Delhi University, head of department political science, and his educational qualification is that he has done MSc, MA and MPhil from Delhi University in political science. And let's without wasting time, let's listen to him about this particular topic. He may be giving a different dimension to the entire the discussion whatever we have had in the past. So Professor Ragi, thank you.
Thank you, Professor. Thank you, Professor Praveen. I don't know how to express myself. I'm finding myself, not a fit candidate, not a fit person to talk on the issue, because I listened to very carefully the presentation by Dr. Neeraj and then by Professor Kilani. It was fantastic, and I would I would have loved to hear more from both the the doctors. I can say only the experience of mine while I myself was a victim of Delta, the second wave, wherein I had to be hospitalized. Then subsequently, my wife was hospitalized. Both of my children got infected. What I realized that while the doctors were fighting, the response of the civil society, and particularly the individuals as a member of the civil society, we were not sacrificing our, I would say we were not behaving in a disciplined manner. And as a result, we become carrier of or multiplied the rate of proliferation of the virus. And still I find that when I go to the market, 60% or 70% of the people, they do have masks, but they are not placed on appropriate place on the face. So most of the time they will be hanging, but not covering the mouth or the nostril side. And this is where the concerns arise. While I was in hospital, I found Still, I'm not able to, because I don't have supporting data. But what I realized that had my wife not been with me, despite knowing the fact that I was suffering from COVID, Delta V, my wife was with me in the hospital and she subsequently got infected. But when I realized that those who were on the oxygen, they were in the middle of the night or after 3-4 hours, they used to separate the system, and as a result, many of them suffered the oxygen dipped down because of there was no one there to take care of. Body is slipping and out of going on to the state. So I self faced several occasions when I found that, as my wife shared with me, that I used to remove the the oxygen system many a times in the night, and I realized that probably it would have happened with most of the people who suffered casualty. So was there lapse on part of the hospitals? That I don't know. Second was the psychological loss while you are in the hospital, because you are completely, disconnected from your family members, near and dears. So you are only talking to the phones, and the uncertainty that whether I will be surviving the disease, whether I will be surviving this pandemic or not. And this happened with me also. Once upon a time, I had to speak to my wife that, look, I probably am going to be, going to have the last breaths. And I started sharing where my bank details are, and started writing, a couple of lines, poetic lines, that it is probably my last breath. I don't have any data supporting evidence, but I think that those who are serving in the hospitals or dealing with the social medicines or doing counseling to the patients, can have this data that how many of them suffered this kind of a psychological loss while they were hospitalized or while they were in hospital and facing such kind of problems. So, yes, I was really, when I was listening to the Dr. Kilani and Dr. Neeraj, the kind of medicine. So it was an experience which cannot be expressed in words, that what one used to feel when you come to know that I am facing this virus. Because for many, it was a loss of life, probably whether you would be surviving or not surviving. So this was the basic question that was in mind. And whatever the medicine was prescribed, suppose that I have 2 friends or 3 friends, doctors, I was talking to everyone. And, there were variations in prescriptions. There was no, ivermectin or hydroxychloroquine. These were some of the medicines which were very much common to all the prescriptions, but there were a couple of medicines which were not common to a couple of prescriptions. So as an individual, you lap on all the medicines which are prescribed to you, whether they have done damage to the system, organic system, biological system of an individual or not. I haven't come across any such research. I think that these are some important aspects which I feel that the hospitals should, use the resources to investigate into or research into, so that credible data could be out for every individual's benefit. So as a society, I feel that we have done a lot. Civil society was taking care of food and other things. But at the same time, the kind of the public awareness and the response was not up to mark, and it is not up to mark the way we find the markets flooded with the people. Even if there is no need, they are going to the market. The malls are, crowded. Even if, we go weekend days, we find that they are crowded place. So they are the one which are multiplying it. And I think that somewhere the public awareness and the the potential threat to life, individual life, and to society, and consequential loss to the nation, that needs to be taken account of. More and more public awareness needs to be, created at this moment of time. This is all unstructured and stray thoughts that I have in mind. I told you in the beginning that I considered myself completely unfit or misfit person to talk about this, because ultimately I salute all the doctors, the hospital staffs who have done really wonderful, service to the nation, individuals, the way they cared. But more and more things need to be done in this respect. Thank you so much, Pravinji. I don't know. I don't have any much to say on this issue. Thank you so much.
Professor Ragi, my name is Bhargav Mitra. I will take over from Pravinji because he had to leave for some webinar. And you actually presented the social side of COVID. The doctors or experts that we have on the panel, they presented the technical side of the issue. But you touched upon the social side and the personal side of the matter. And you also cited examples from your own family. But I would say that, to keep yourself in good spirit, despite what is happening around, is of enormous importance to all of us. Many people have perished because they became despondent. They left, they lost all hope. Losing hope is the easiest thing that we can have. We lose hope very easily. That's what I have seen. And even situations which are surmountable, just because we lose hope or give up on hope, we perish or succumb. It is very easy to panic, but not everybody is going to die. But many have probably died because they went panicky. In the first wave, in the second wave, you must have seen. A lot of psychological stuff was going on besides the technical or the medical aspect of COVID. So COVID had a huge psychological burden on us. And I think it's a reminder to all of us that as we prepare for the third wave, to tackle the third wave, we need to be slightly mentally and psychologically stronger than we were in the first two waves. because a couple of things are not in the hands of doctors, they are in the hands of the individuals. And how do the individuals at their own level deal with these issues also matters a lot, because the doctors will have a kind of, a boundary. They can only go up to a point. But beyond that, the individual has to take over the reins of his life. And that is something which is critical in such matters. So I think, you touched upon a very important aspect, and you don't have to at all feel sorry that, you are whether equipped or not. None of us, as far as if you ask me, I'm absolutely not equipped. I'm a diplomat. So I'm totally unequipped to either moderate this seminar or say anything about it. But, we can always talk from the psychological point of view, which you actually did. So you did play a very important role. And Professor Ragi, thank you so much. I've heard you on other seminars also, and you have been very, very elucidating in your approach. And thank you for coming, and thank you for joining us. I'll very briefly address Dr. Nishchal, if he's around, that I think we will have the last speaker after this. And Dr. Nishchal, there's quite a few questions for you. We will be taking up immediately after Dr. Dwivedi finishes his address, and then we'll go to you for your answers to quite a few questions that the listeners have posed. So, ladies and gentlemen, I invite Dr. Shashank Dwivedi. Dr. Dwivedi, you are with us? If you are there, then can you switch on the video? Dr. Shashank Dwivedi? If you are still around.
Till the time you can take question from near initial.
So till the time, Dr. Shashank Dwivedi joins, I would take the questions for Dr. Nishchal, and which have been pretty important, because your lecture touched upon quite a few important issues. The first question to you came in the chat box from Mr. Amrinder Singh, and he wrote, have we developed herd immunity? As we can see, the current wave is not that dangerous. How long the COVID will go on? Any predictions? So you have to be an astrologer and a doctor both. Should we treat COVID now like any other normal flu? Dr. Nishchal, the floor is yours.
Yeah, this important question, whether we have developed herd immunity. Now we have to realize that this is a global pandemic. It's not just only something which is affecting India. And I think it was WHO director who recently said, no one is safe until everyone is safe. And that is something which I feel is very important in the context of current pandemic. So maybe we might have developed a certain herd immunity as far as our country is concerned in terms of the natural infection which majority of people had by this time, plus the vaccination program, which is one of the most robust across the globe, the country which is having right now. From that point of view, yes, we may have approached that. But at the same time, we have to remember somewhere in the underdeveloped part of the world, this vaccine has not reached. The pandemic is still raging at the same level. The more the virus replicates, the more chances of a new mutant to appear and bypass all the immune response we have developed so far is always there. So if you ask me, have we developed herd immunity by now? I will say no, unless there is a global herd immunity where everyone has developed immunity in some way or the other, whether vaccination or natural vaccination. I don't think we are safe because in present context of fast means of transportation, even one patient from any part of the world with that dangerous variant reaches our land, then of course everything is gone. And that's why what we have been seeing, that certain countries are giving boosters and boosters to their residents, but that should not going to matter if pandemic is raging in some part of the world, they are deprived of those vaccines. Then I don't think we are going to achieve that herd immunity. So I feel it's too early to say that we have actually acquired this herd immunity, and we have a long battle in front of us. And I feel next 1 or 2 years is going to be crucial. We cannot rest on our laurels like, okay, we have vaccinated our population, we are fine now. Because like I said, anywhere in any part of the globe, if this pandemic is raging, we are not safe.
Thank you, Dr. Nishchal. In fact, okay, thank you so much for this clarification. There are two questions from Dr. Uday. After that, there is one question from Mr. Krishnadev Pandey. there is one, and then finally, I have a couple of questions which I'll be asking at the end, which I've already put in the chat box. So I'll start off with the question which Dr. Uday posed some time ago. He said, I'm traveling on a long-haul flight to the US via France, and there's a transit of 4 days in the European Union. What all precautions should I take while flying? That is Dr. Uday's question to you.
Yeah, so European Union, say UK perhaps has lifted all the COVID restrictions per se, but I will suggest him the only way to protect yourself to ensure that you continue following your COVID appropriate behavior. Mask is a must. Try avoid going in a place where people are not wearing mask or a crowded place. So that is something which you can do, and that is the only way you can keep yourself safe. And again, the European Union are still saying high number of cases, so it's very risky to be in crowded place. So at the moment, if you are vaccinated, you are following COVID appropriate behavior, you are not exposing yourself in a public place, then you will definitely stay safe.
Thank you, Dr. Nishchal. Another question from Dr. Uday was that he said, my wife and I have taken to Sinovac in June 2021, then to Moderna in November and December the same year. Is there a need for more booster doses? And he said they are currently living in Thailand.
So again, I like said, I mean, taking booster again every second or third month is not going to solve the problem. You have to keep on following COVID appropriate behavior. And since you have taken a complete series of 2 different vaccines already, then I don't think you require a booster right away. But yes, whatever guidelines are there in Thailand, you should follow that because each country have their own set of guidelines. But as per se, if you ask in terms of Indian context, we will not recommend a repeat booster for you.
Mr. Krishnadev Pandey has asked a question. He says, when you talked about infodemics, I believe he was inspired to put this question. He writes, how many demics? And then he goes on to say, how do the demics take a course? Or I understand probably wanted to say what course the demics might take, probably in that sense.
So again, I mean, I read that question. I could not make much sense of that. So if he could clarify what exactly he wants to know, uh, because we are saying seeing a lot of other aspects which is going along with the actual pandemic. So this information, I will say, misinformation pandemic is something which we as a doctor have faced a lot because, like again, a lot of treatment options that have been one thing I will definitely say that the treatment options which are touted as a game changer, we have not seen any that treatment changer. Of course, I have some divergent view from what Dr. Kilani said. Again, the drugs like molnupiravir, which has been touted as game changer, actually there is no robust data as such. Even if you say US FDA approval, the voting was 13/11. So if it was such a game changer of a drug, why did it receive 11 vote against it? And the data which they have said, nowhere they have mentioned that it's going to save life. It just said relative risk is reduced by 0.3. So that if in current scenario, it hardly translates into anything. And the potential of harm this particular medicine can do because it induces mutation in the virus. That is how it kills that virus. So any cell in our body which is rapidly multiplying, it has potential to cause mutation in all those cells. And that's why if we use this drug injudiciously in the name that it's going to prevent you from getting a serious disease, I say this is a precursor to another pandemic within a pandemic, the way we saw that mucormycosis created such a havoc in our country after second wave. So if we do not regularize the use of this particular medicine, which has been given emergency use authorization. Unfortunately, in our country, emergency use authorization is being taken as over-the-counter drug where any Tom and Harry can go and purchase this drug without any restrictions. And a drug which is experimental drug, if used in such a large scale, is definitely bound to cause problem. And this is something which we have been again and again warning. None of the national guidelines actually have advocated use of this drug because we have no faith whatsoever. Let me be very clear and frank about this. We have no faith in this drug because the way it has been approved, without taking into consideration what risk it can cause to general population at large, because US FDA has said this drug should be used in those over the age of 60 with comorbidities or at risk of developing severe disease, provided there is no alternative treatment option. This was the rider with which this was given authorization. And now this is being touted as a game changer, which is completely wrong and should not be used. So these type of drugs have to be regularized. I'm not saying, of course, it's a drug which needs to be tested, but you cannot make a large population a target for your medicine, which still needs to be proven. This population in which it was used was unvaccinated, without comorbidities, and lot of other issues which does not exist in current scenario. So I will say all the antivirals which are being marketed and the monoclonal antibody again, they have no role in current pandemic. Majority of us will improve without any of these fancy drugs. Pandemic doesn't mean that you will require magic pill or at least 8 to 9 drugs to cure you. This is a viral illness ultimately. If you have comorbidities, does not mean you will get a serious disease always. It's not that. Even in patients with comorbidities, a small fraction are going to get a severe disease. So this, I will feel the use of all these new drugs that needs to be actually regulated and given in appropriate set of patients and not in each and every patient. That is something which we have to be very careful.
Dr. Nishal, before I go on to ask some of the questions that I had posed, if Mr. Amrinder Singh is listening to us, then he may like to straight away, in the course of the discussion, switch on his microphone and ask this question with much more clarity than it has been put here in the chat box. Dr. Nishal, one or two simple things I wanted to clarify for myself as well as for the audience. In what way is Omicron, or how do you pronounce it? Is Omicron or it is OMICRON? I mean, you are the best person. I mean, you spelt it out or you pronounced it differently.
No, again, it's a sign. So people may pronounce it as Omicron or Omicron. So we prefer to pronounce it as Omicron, but both way it's fine. I mean, there's no difference between two because it's Greek.
The doctors,
yeah.
I will leave it to the doctors to pronounce it as Omicron, and I leave it to the general audience to describe it as Omicron. It will be. My question is, in what way is Omicron less infectious, as I am hearing, and less severe than the previous variants? And could it last longer and be less severe, or its profile may change over the course?
So during my talk, I said the virus is trying to evolve, and the best, because its best bet to survive is to coexist with human host. So infectiousness has increased. There is difference between getting infection and getting disease. Infection means that particular pathogen has entered your body. You have got infected. But unless it manifests as a symptom, you are not taken as diseased person. So this virus is more infectious than its previous versions. So Omicron is more infectious than Delta, Alpha, or Beta, the previous versions. But what we have observed that the severity of disease it's causing is much milder as compared to the previous versions. So there are different hypotheses for that. One, people are saying, okay, whatever mutation has happened, it is just increasing the infectiousness of the patient of the virus, but at the same time, it is not able to invade lungs the way Delta virus used to. So it's more focused on the upper respiratory tract. So that's why most of the majority of patients have throat-related problems like cough, sore throat, fever, just upper respiratory tract infection type of thing. But Delta involved lungs and causes severe inflammatory response. So is this entirely because of the property of the virus or because of the vaccination, the immunity conferred by vaccination, or majority of people had natural infection as well? So what is actually working in favor is still not clear. But yes, this virus is more infectious, no doubt. But at the same time, it is not causing that severe disease as the other variants were causing.
Dr. Nishal, another thing which came to my mind when you mentioned about the misuse of immunosuppressants, I mean, you spoke about this aspect. So I think it's very important for all of us to know how are we actually misusing it and what can be done to really stop this misuse and why.
Yeah, so again, that is what I'm talking about, infodemic. So this misinformation pandemic, somehow during second wave, message went to the mass that steroid is treatment for COVID-19, which was not the case. So it was very important. See, steroid, the role of steroid was to prevent complication in certain group of patients. So people who thought, no, this is treatment of COVID-19, once they got infected, started steroid right at the start without any complication as such. When you immunosuppress any patient with steroid, then of course virus has higher chance to basically replicate because your immunity is not able to control that. So that led to prolonged viremia, and once steroid was stopped, the patient landed up into a cytokine storm, which caused a lot of problem. So the role of steroid was in a set of patients where the immune response, which was generated because of the virus, went rogue. So you can say, okay, if you send a police to catch thieves in such certain area, once the police has caught thief and the police is not controlled, starting hitting the normal onlookers, the general public, then that is going to harm the society. The same way, the immune response, which was meant to control the virus, and once the virus was controlled, but there was no regulation on the immune response, which kept on harming the normal regular cells of the lungs and various other organs. And that is what was called as cytokine storm. So the role of steroid was in that set of patients, but somehow people thought, okay, this is treatment of COVID-19, started taking steroid without any supervision, in fact, and for prolonged times. So one immediate harm was that the patient actually lost life during that COVID-19 itself. Those who survived had other complications like, say, the mucormycosis complication, which we saw in a lot of patients. So all these problems arose because there was misinformation circulated among general mass ki this can actually help. So I think that was the biggest challenge which we faced during second wave, of course, apart from the number of cases we had, but the treatment which everybody thought they are the COVID expert, they are the doctors, and that created a lot of problem as a doctor for us as well.
Okay, Dr. Nishal, in fact, one very small question which I had already put there before we go on to Mr. Ravi Tandon, I mean the last question for you thereafter. So my question was that in course of your presentation, you mentioned that the women have more chances of post-COVID recovery. I mean, that's something that you had mentioned.
For long COVID, it was an observation in a study.
Symptoms.
Yeah, long COVID symptoms that was observed more in female. That was part of a study. So it could be related to multiple factors, whether it's a genetic thing or how they took that particular disease. Of course, our previous speaker talked about this COVID-19 from a patient perspective. How lonely, how alone they were in that COVID ward without any support, with the fear whether they are going to see their loved ones after after recovering from this disease or not. So there can be multiple aspects which can affect females more. There is no definitive pinpoint factor why females were found to have more chances of having long COVID. It was just observation of one of the studies. So I won't say this should be generalized. In that particular study, it was seen that females had a higher chances of having long COVID syndrome. That could be because of multiple factors.
So much. Mr. Ravi Tandon asks, many people after vaccination or infection show low antibody titer. Is it something to be concerned about, or T cells are able to take care of infection?
So again, there are a lot of antibody tests. What antibody they are testing is again a question mark. Whether it was tested with a validated antibody assay, how it was tested. And of course, one of the important component of this immunity is T cell immunity, which cannot be calculated or measured with this antibody assay. So at the moment, whatever antibody assay we do is more for research purpose. There is no definitive cutoff or say, okay, if a person has this much antibody level, then he's protected. So I will say at the moment, antibody assay are more for research purposes. If your antibody level is low, that doesn't mean you are not protected. And if you have higher antibody titer, then you are better protected. It's not like that for the time being. So everybody should be following COVID appropriate behavior. That is important.
Thank you enough. Happening with, you spared your time, you chose a subject, you chose to discuss the points in great detail, and not only with technicality, but from a social perspective as well. Thank you so much, Dr. Nishal, for coming, sparing your time, coming here, and speaking to an audience which is very keen, which very keenly listen to you. And in fact, we are all part of that audience. And thank you so much again for all your help and all your insights.
Dr. Milani ji also is joining from USA. Dr. Milani Darswal.
Okay, so we will now quickly move on to Dr. Shashank Dwivedi. And Dr. Mrinalini Darswal will be joining thereafter. In fact, welcome Dr. Mrinalini Darswal on the webinar. Dr. Shashank Dwivedi is an astrologer. I mean, at a time when COVID pandemic was surging, first wave, second wave, many of us actually turned to astrologers for solace. We always go to astrologers and consultants and healers, spiritual healers, gurus. So he's an astrologer, he's a Vastu consultant. If Dr. Shashank Dwivedi can switch on his video, we can see him on screen. He's an international spiritual guru, and his command over astrology and palmistry are well noted. So if Dr. Dwivedi is around and listening to us, Dr. Dwivedi, if the floor is yours. Aaj can confirm that Dr. Dwivedi is online with us?
Dwivedi sir, join kar.
Dwivedi, can you listen to us?
मैंने आपको शॉर्ट लिंक भेज दिया, शॉर्ट लिंक मिला आपको, शॉर्ट लिंक उसी में ज्वाइन करिए ना.
Dheeraj ji, what we can do is that Dr. Mrinalini is with us. Has she joined? In case she has joined, then we can listen to Dr. Darswal, and then we can go to Dr. Dwivedi. Dr. Darswal is here with us.
I think she was also about to join. 1 second. BK Singh sir ने बोल दिया. BK Singh sir, आपका हो गया? विनोद सर
है, लेकिन उन्होंने बोला नहीं है अभी.
नहीं, Dr. BK Singh उनका वीडियो ऑफ है, तो maybe he can address in the meantime. Will buy some time.
Yes. In the meantime, they will also join.
Dr. BK Singh, the floor is yours. As the other speakers are about to join us, they would like to hear something from you. Dr. BK Singh, are listening to us?
Let me call him, sir. I'm calling.
Please.
Yeah, just.
And the moment Dr. Darswal or Dr. Dwivedi, they are around, then you please sound me so that we can invite them.
Yes. द्विवेदी साहब, लिंक मिल गया ना? नहीं, नो सच मीटिंग नहीं. एक सेकंड सर, एक सेकंड. बीजू.
Yes, sir.
द्विवेदी साहब इज इन द लॉबी, और उसमें वो दिखा रहा है नो सच मीटिंग. ये क्या है? आपको ज्वाइन करवाओ बीजू इमीडिएटली.
उनको फोन करने से नहीं, he is not picking.
Dr. BK Singh is here. I can see his face. Dr. BK Singh, welcome. You are looking very fresh, and we were looking forward to seeing you on screen. So the floor is yours, Dr. BK Singh.
वो हैं हमारे जो टेक्निकल हेड हैं, उनका
धीरज जी,
नंबर
आप अपना जो माइक है ना, उसको आप म्यूट कर लेंगे तो हमारे बीके सिंह साहब को हम सुनेंगे. आप
नमस्कार भार्गव दादा, नमस्कार धीरज जी और सारे जो डिस्टिंग्विश्ड स्पीकर्स, सभी को नमस्कार। आज का टॉपिक बड़ा इंटरेस्टिंग है। एक तरीके से, एक तरह से या दूसरे तरह से सभी ने जो कोरोना है उसकी जो ताप है, उसकी जो गर्मी है, उसका जो पेन है, उसको फील किया है। हमें लगता है कि शायद ही कोई हो जिनका कोई मित्र, कोई नियर रिलेटिव, कोई फ्रेंड, कोई परिवार का सदस्य इस एपिडेमिक में नहीं खोए हों। इस सब को देखते हुए बड़ा ही रेलिवेंट है आज का जो वेबिनार है, उसका आयोजन जो है। और इतने सारे डिस्टिंग्विश्ड स्पीकर्स बोले हैं कि कोरोना का जो टेक्निकल एस्पेक्ट है उस पर बोलने के लिए बहुत कम रह जाता है। इतनी शानदार प्रस्तुति और इतना टेक्निकल एलेबोरेशंस के बाद और भार्गव दादा का जो क्वेश्चन सेशन था जिसको कि उन्होंने कोऑर्डिनेट किया, उसके बाद बहुत सारे कम क्वेश्चन रह जाते हैं। मैं थोड़ा सा अपना अनुभव बताऊंगा कि इन सब चीजों के बाद कोरोना से डरना नहीं है, लेकिन सावधानी क्यों जरूरी है। हम अपना अनुभव बताते हैं। जब डेल्टा वाला चल रहा था अप्रैल में, तो मैं अपने गांव में था। वहां पर कुछ गेस्ट आए, कुछ गेस्ट जो है, मैं जस्ट अनुभव है जिस सीखने के लिए है, थोड़ा रेलिवेंट हो सकता है। हमारे एक गेस्ट आए, वो बस से आए, दिल्ली टू दरभंगा, और वोल्वो बस से आए। तो जब पहुंचे उस रात में, तो हमने कहा कि आपका तो क्वारंटाइन बनता है, आपने पब्लिक बस में सफर की है। तो अगली सुबह देखे कि वो अपनी बच्ची को गोदी में खिला रहे थे। उसके बाद मैंने फिर उनको टोका कि आप जो है अपनी फैमिली के साथ मिंगल कर रहे हैं, आप ट्रैवल करके आए हैं। उसके एक सप्ताह नहीं लगा, ये डेल्टा का मैं बता रहा हूँ अनुभव, कि 2 से 3 दिनों के बाद उनकी बच्ची को हाई फीवर था। वो गोद में थी, बच्ची को हाई फीवर था, वो रो रही थी। फिर उसके बाद उनकी वाइफ को हुआ, फिर उनके बाद उनकी सास को हुआ। और इस तरह से कोरोना जो है डेल्टा गांव में भी फैल गया। मैं माता जी के श्राद्ध में गांव में था और उनकी बॉडी को लेके गया था। तो उसी दौरान जो है सो होता गया, सबका ठीक होता गया। जो इरिथ्रोमाइसिन है, जो आइवरमेक्टिन है, जो डॉक्टर से पूछ करके उन सब का जो इलाज है उसको मैंने कोऑर्डिनेट किया। जो हमारे कुछ डॉक्टर्स फ्रेंड हैं उनसे टेली कम्युनिकेशन करके हमने किया। लेकिन उसमें से एक केस है, एक फकीर पंडित है जो हमारे यहाँ जो ट्रस्ट है, चैरिटेबल ऑर्गेनाइजेशन है, उसका ऑफिस इंचार्ज है, उसका केयर टेकर है, उसकी चाबी रखता है। तो उसको भी फीवर हुआ। पहले उसकी वाइफ को हुआ, फिर उसको हुआ। और उसको जो फीवर हुआ तो मुझे शक लगा। उसने फोन, मैं उनको रोज सुबह शाम फोन करता था मोबाइल पर। तो उन्होंने फोन पर बताया कि सांस लेने में तकलीफ हो रही है। मैथिली में बोला कि दम नहीं धर पा रहे हैं, दम खींचे में दिक्कत भा रहा है। तो हम जो है, मैं जो हूँ सो ऑक्सीमीटर लेके उनके यहाँ पहुंचा। तो हमने देखा कि 87 था उनका ऑक्सीजन लेवल। और दूसरी बात था कि मैं मास्क लगा के गया। उनका गांव मेरे गांव से 2 किलोमीटर दूर है। मैं ट्रेवल किया और कोरोना के डर से उसकी वाइफ केवल उसके साथ दे रहा था। वाइफ को छोड़ के उसका भाई, उसका रिलेटिव, सभी ने साथ छोड़ दिया था। मैं रूरल एरिया में इम्पैक्ट बता रहा हूँ। तो मैंने वहीं पर देखा कि मैं मास्क लगाया हूँ और फकीर पंडित जो है मास्क नहीं लगाए हैं। मैंने उनको मास्क दिया, मास्क लगवाया। फिर हमने डॉक्टर से फोन किया। तो डॉक्टर ने मेडिसिन प्रिस्क्राइब किया और उन्होंने जो है सो मेड्रे लिखा। जो डॉक्टर साहब बोल रहे हैं कि स्टेरॉइड जो है वो बिगिन नहीं करना चाहिए, लेकिन जो भी हो, सांस की दिक्कत थी तो प्रॉब्लम तो था ही। तो स्टेरॉइड शुरू किया। और फिर हमने डॉक्टर साहब से पूछा कि इनको जो है सो हॉस्पिटलाइज कर दें। तो डॉक्टर ने कहा कि हॉस्पिटल में कौन देखेगा इनको, गरीब आदमी है और हॉस्पिटल का फी नहीं दे सकता है। सरकारी हॉस्पिटल में रात को सारे नर्स और वो छोड़ देते हैं। तो आप जो है एक दवाई और मंगाइए और ये सांस की पोजीशन को, ऑक्सीजन इनटेक को इम्प्रूव करेगा। तो हमने तुरंत, वो एक लड़का था विक्रम, उसको मोटरसाइकिल से भेजता था। 3 बार 4 बार वो जो है सो 15-16 किलोमीटर का शॉर्टेज लिया और उसको मेडिसिन दिया, लेकिन फॉर्चुनेटली अगली सुबह जो है उसको ऑक्सीजन लेवल फिर से जांच किया तो उसका इम्प्रूव हो गया था, 95-96 हो गया था ऑक्सीजन लेवल। तो कोरोना जो है वो, चाहे वो ओमाइक्रोन हो चाहे जो दूसरा वैरायटी हो, ये खतरनाक बहुत है और ये किस लिम्ब को, किस अंग को नुकसान कर दे। हमारे एक फ्रेंड थे यहाँ पर, प्रदीप चौधरी, चार्टर्ड अकाउंटेंट, उनको लीवर का प्रॉब्लम था और जब कोरोना हुआ तो उनको जो है सो लीवर में वो इफेक्ट कर गया एंड ही कुड नॉट रिकवर। आफ्टर 40 days 50 days ही पास्ड अवे। तो हमें सचमुच में कोरोना से डरना नहीं है, लेकिन जो सावधानी है उसमें उसको बरतना है, चाहे वो मास्क हो, डबल लेयर मास्क हो, चाहे डिस्टेंसिंग हो, चाहे जो सैनिटाइजेशन है, या फिर कमरे को वेंटिलेटेड रखना है। और बहुत ही रेयर हो अपॉर्चुनिटी, बहुत ही प्रेसिंग फैक्टर हो तभी हमको मार्केट या कहीं पर जाए। पब्लिक मिंगलिंग जो है फिर भी हो जाता है, लोग करेगा क्या, काम होता है। हमने दवाई की दुकान पर देखा कि भीड़ है, पिछला जो खरीदने वाले हैं वो आके हमसे सट के खड़ा हो गए। तो सोशल डिस्टेंसिंग की बात क्या है, फिजिकल डिस्टेंसिंग में भी लोग डिस्टेंसिंग मेंटेन नहीं करते हैं, अभी तक भी सुधार नहीं हुआ है। और सभी लोग उतने फॉर्चुनेट नहीं होते हैं जितना फकीर पंडित थे जो ठीक हो गया। तो हम यही कहेंगे कि ये अभी काफी स्ट्रगल बाकी है, अभी ये लड़ाई खत्म नहीं हुई है। लोग बोलते हैं कि ओमिक्रॉन जो है वो लास्ट फेज है कोरोना का। किसी का कहना था कि वो सबको होगा और इसके बाद फिर कोरोना खत्म हो जाएगी। तो हम जो डॉक्टर साहब हैं जो बोले हैं उनसे जस्ट हम क्वेश्चन मार्क कर रहे हैं कि क्या ये लास्ट फेज है, इट इज द ओमिक्रॉन फेज इज द लास्ट फेज ऑफ कोरोना। और इनके साथ ही मैं ज्यादा नहीं कहना चाहूंगा, मैं सारे आयोजकों को धन्यवाद देता हूं। और मैं बीके सिंह, मैं वाइस प्रेसिडेंट हूं एलुमनाई एसोसिएशन ऑफ जेएनयू का। और भार्गव साहब और धीरज जी और इनको जो है मैं फर्स्ट फेज में नहीं उपस्थित हो सका क्योंकि मैं किसी काम में था और ट्रैवल में था। तो एनी हाउ कैरी ऑन, और मेरा बेस्ट विशेष सबको कि कोरोना पर जो ये सेमिनार है वो हजारों लोगों को कोरोना से बचने में मदद दे। अगर एक भी आदमी इससे लेसन लेके अगर इसके प्रचार प्रसार में इसके प्रसार को रोक सके, इसके बीमारी को ठीक करने में मदद कर सके तो सही है।
ज्वाइन कर गए जी।
हाँ हाँ, तो आप शुरू कीजिए। थैंक यू वेरी मच।
Thank you, Dr. B.K. Singh, for your insights into the problem that all of us are facing. Ladies and gentlemen, we have amongst us Dr. Mrinali Daswal. Dr. Daswal was a medical professional before she decided to change course in life and become an IAS officer. Now, the combination of a doctor and an IAS officer is considered to be very, very useful because you have the insight into two very important aspects of one's life. At this time, whether her profile as a medical professional takes precedence over her job as an administrative officer, or maybe the administrative officer takes over the mantle and then the medical professional is pushed in the background. That is entirely up to the different situations that she's facing in life. I understand it's a very homogeneous combination of both these talents or capabilities as far as she's concerned. Dr. Daswal has served as Special Secretary Health, then Commissioner Food Safety, Drug Controller, Project Director for HIV/AIDS Control for the Delhi government. And currently she's pursuing her PhD from Harvard University. It's a very ominous kind of combination that she possesses. And she's also stated to be the only Indian among fellow foreign citizens students who is studying this multidisciplinary degree that provides advanced education in public health. We have been given to understand that Dr. Daswal has done some seminal work in this area of public health. In the current situation, I think there could be very few experts who have the insight on both sides of our lives currently, as an administrator, as a medical professional. So I would request Dr. Daswal to take the floor and enlighten us with her thoughts. Dr. Daswal, the floor is yours.
Thank you, Mr. Mitra, for a very generous introduction. First, I must apologize that I was late because I was confused about time. I'm so sorry. I should have joined earlier, but I was totally confused because there's a snow blizzard blowing here, and that is enough to keep you confused and inside. And second thing, I'm just a student of public health currently, getting exposed to various problems that various countries are facing. And it is just at a time that this pandemic is ravaging the world. And therefore, it's just a coincidence that I am given and kind of constrained to study that in depth. But so far, I have not produced any seminal studies. But I do have a fairly good idea because that is a part of the curriculum. So let me tell you what is happening currently in the field of Omicron as far as US is concerned. And also I can give you some insights on what the other countries are doing. But I heard Mr. Singh currently, and I'm so happy that I am sharing the stage with such illustrious presenters today, who unfortunately I've had no occasion to listen today. But I'm very sure they must have already told you what I'm going to tell you. And at the cost of repeating whatever been said in this meeting and apologizing for that in advance, I have just a few things to say about Omicron. And those are the, the patent and the potent questions in everybody's mind, including the common people, the policymakers, as well as scientists themselves. So first is the Omicron wave the end of COVID? Unfortunately and potentially not, because if we go by history of this virus, now we have a long history as far as any disease is concerned, an endemic or pandemic disease is concerned, we have enough data. And we have seen that this virus is very capable of evading immunity. So even when people got Delta, they are not immune to getting Omicron. That means new forms of this virus can emerge and they can keep on reinfecting people again. And since the mutations are so diverse and so wide and so unpredictable in this virus, we do not know whether the next variant, firstly, we are not sure whether it will emerge at all, but there is a high likelihood that it will emerge because we still do not have attained sufficient number of vaccinated people in the world. And this virus does not follow boundaries. So the variants have largely now been emerging from the areas where vaccination rates are low, and the effective reproductive number of the virus remains high. That means the virus always has a chance to transmit among people who have not been immunized actively against the virus through vaccination. And both vaccination and an earlier infection do not provide lasting immunity. So right now, as the virus is emerging, the new science on countering it is emerging, including vaccination. So we have seen that 2 doses of vaccines, which we were using, including AstraZeneca, the mRNA vaccines in the rest of the world, in America especially, 2 doses were very, very effective against Delta. But 2 doses of these vaccines have shown almost zero neutralization activity against Omicron. And for Omicron, the actual full coverage of vaccination is 2 doses plus 1 booster. Because we do not understand the mechanism as yet, but the 3rd booster gives the same kind of immunity, the 2 doses against Omicron, like the 2 doses gave against Delta. That is 90% hospitalization and severe cases are prevented, but vaccination neither prevents infection, symptomatic infections, nor does it prevent transmission. among vaccinated and among asymptomatics. And what we scientists know so far is that the asymptomatic transmission of COVID has been the main mechanism through which community transmission of COVID has been sustained. So if you have COVID, you're fully vaccinated, you have had a disease before COVID, but still if you get the virus, you will be transmitting it. And who will you be transmitting it to who are at more danger of becoming sick with it is those people who are not vaccinated, who will be sustaining this infection later on in the community, because you will clear the virus earlier because you are vaccinated, your immune system is working against the virus, but those people would not be able to clear the virus. And also those people who are immunocompromised, who have comorbidities, whose systems are not able to fight the infection very well as normal people. So this is actually the mechanism through which this virus is getting sustained. And unfortunately, this virus has shown very, very unpredictable trajectories. But I think the main reason behind this is we have not been able to vaccinate every person on this planet, which I think was sine qua non, or which was quintessential for preventing the emergence of new viruses, because a vaccinated and an immune person will not give time for virus to stay inside and get mutated. And then when unvaccinated, there is an epidemic in the unvaccinated of a new variant, then it quickly transfers to the other countries because there are no boundaries anymore. The travel is like open, and shutting down the travel, there is no scientific evidence that it is going to prevent the transmission because it will always reach. The virus has ways of reaching because human migration can never be stopped because it is essential for our livelihoods to travel. So no amount of closing the borders is going to stop this virus from transmitting. So like I heard the last speaker say, our first duty, and where I'm very proud that India is doing very, very well despite our population, is vaccinating everybody. And if we have constraints on vaccination, we must vaccinate with 2 doses everybody, and with a 3rd dose, the frontline workers and those who are more vulnerable to getting this infection, so that the virus does not get the host to stay inside, linger, and perpetuate, and then remodel into something new, which we cannot tackle. And all over again, then there becomes this talk about the next wave, the necessity of lockdowns, the necessity of enhanced behaviors. Fortunately, Omicron so far has proven to be more milder than Delta, but given its sheer numbers, the hospitalizations in US were more than what they were with Delta. But fortunately, the deaths are less. But again, because of the sheer numbers, the death number is staggering. Almost 2,000 to 2,300 Americans are dying every day of this virus. So this is unprecedented. We keep on saying Omicron is mild, but look at the numbers. Even if it is mild and it kills a smaller percentage, just because it infects larger percentages, it affects those who are not vaccinated more. It affects those who are vulnerable more. It affects those who are in hospital more. They are going to die in larger numbers. So there is absolutely no time or occasion for anybody to let our guard down during this wave. And masking is the most potent weapon. If you're not getting a vaccine, stay masked all the time. Given our population, given the constraints of our transportation, given the constraint of office spacing, given the constraints of school spacing, another potent weapon besides masking, because I don't think social distancing is that much possible in India. Once you see people traveling in Mumbai local trains, even now, despite the spurt of the pandemic, you would know that it is almost impossible. We are actually imposing an impossible condition on our people who have to depend on such travel for their livelihoods. Another important thing is ventilation. Stay out in the open as much as possible. Maybe hold classes out in the open if classroom space is limited. You can hold offices in the open if the weather permits. Ventilation, keep the windows open if the weather permits, but circulation must be there, some kind of air circulation. And that is again highly preventable against spread of coronaviruses of any kind. So these are some of the few things, of course, hand hygiene and other COVID appropriate behaviors. But in most of the Europe, the restrictions regarding COVID viruses are slowly being now taken back. And except the vaccine mandates, other mandates are being withdrawn. And the countries are actually spreading the message that COVID is now endemic and we do not have to worry anymore about that. I think that message is very premature because we saw such a message circulate in India before second wave struck, and we saw the devastation the COVID caused. My family is waking up, so you will get introduced to all of them one by one. They're walking beside me. I'm sorry about that. But that is the final thing I wanted to say, that this virus is treacherous, and this is not the time for us to let our guard down. And all of these things have to continue, the COVID appropriate behaviors. But I think the most potent weapon against complete stoppage of emergence of new variants as well as transmission of existing variants is get vaccinated, get boosted, and wear a mask. So with these three, and of course, keep your windows open if weather permits. With these, I would say relatively simple measures, because India is doing fascinatingly well in vaccination, and we should be able to cover. And India is also doing, donating vaccination to other countries, African countries, through SEPC and other platforms. That means we understand that nobody is safe unless everybody is safe in this pandemic. And this is our duty, not only to vaccinate our own people on priority, but also to ensure that the entire world where vaccines have not reached, because those are the hubs, those are the petri dishes where the virus will keep on getting occasions and chances to get mutated, transformed, and maybe, God forbid, emerge in more potent and more virulent forms. And we have to prevent that at any cost. So I think we have a very highly reputed expert of diplomacy, Professor Ragi here. I don't see his name, but I hope he has already spoken about how important it is for us to maintain this new multilateral diplomatic and medical relation with other countries. We have very strong relationship as regards pharmaceuticals is concerned with African countries. Now that relationship has to be strengthened through our donation of vaccines to them. And in that manner, India will also be serving the humanity by stemming the spread of this virus. And finally, we may be able to get back to our normal lives. Thank you.
Thank you, Dr. Darswal. In fact, Professor Ragi did speak some time ago, and he was being apologetic, and I tried to assure him that, he need not be, because he thought that he was in the company of some highly impressive medical professionals, and he found that he was an odd man out. So I told him that, in his speech, he had touched upon some very important social aspects. I mean, there is a lot of social aspect to the whole trauma or the incident than the medical aspect. And I also mentioned that many of us have actually perished because of the anxiety syndrome. We have gone into depression, and we have actually allowed ourselves to sink into something which we should not have otherwise. And in large parts, the infodemic that Dr. Neeraj Nishchal from AIMS, he had touched upon when he spoke about infodemics. He meant the information overload, unnecessary information overload. I mean, we have, in the last 2 years, the spurt in the number of experts, self-styled experts, I would call them, mushrooming in India has never been witnessed ever in our history. Everybody on WhatsApp is a self-styled expert on COVID. And the propensity to forward messages has been probably the biggest bane of this entire COVID thing. And there are some, I would really term them as nonsensical forwards, and everybody, people start taking every forward very seriously. Those who are either panicking or they are in the need of immediate relief. Immediate relief will not come through WhatsApp messages. Immediate relief will come through the messages that you are trying to spread. You talked about mask, and Dr. Nishal also showed 7 or 8 ways of how not to wear a mask. So having a mask in your hand or in your throat or whatever, you're using as a muffler or whatever, it's slightly cold, then the mask comes to your rescue. It's ridiculous. I'm currently in Tashkent, Uzbekistan, in the Embassy of India as counselor. But it's so sad to see all this happening. And some of the most informed people in our society, they lapse into these attitudes. But your address was extremely elucidating, and you touched upon some very important things. You also spoke about how a society should deal with this, how we should actually deal with this. I mean, if each one of us becomes more alive to the situation, we could have actually saved more lives. We did not do that. Probably we are depending on the third or fourth or sixth wave to be less severe so that, we can be saved. But that is not the way we should look at life. We should actually save ourselves. We could have saved ourselves the Delta variant also. We did not do that. So I think, the couple of questions, in fact, I am the only person who is putting in questions in the chat box. I thought later on I forget everything what I wanted to ask very quickly, if you permit me. Normally, whenever we get this infection, now, is it true that the infection that we are having at this time is 100% Omicron, or it is a Delta, or what? Suppose somebody gets COVID, then what do you say? This is Omicron 100%? That's the first question. I'll go on next. Thank you.
Thank you. For the common person, it is not necessary to know whether it is Delta or Omicron. If you're vaccinated and if you have minimum symptoms, there is no point in knowing, because the course of action is essentially the same. That if you get symptoms, you stay isolated, you get tested. In US, if you do not have symptoms, you stay inside only for 5 days if you're exposed. And then you are released into the community without testing. That is the latest CDC guideline. And if you are symptomatic and running a fever, then you stay inside for as long as symptoms are there. And after the symptoms subside, you stay in for another 5 days, and you do not have to get tested to get released into the community. So these are the isolation and quarantine guidelines in the US currently, which do not have testing as an essential feature of the course, like meeting the course of the disease. Testing is important only if your symptoms are severe and you need to go to a doctor. And again, both the tests, like rapid antigen tests, which detect infectivity when it is at its peak, and the PCR tests, which detect infectivity for a longer time, are able to detect both Delta and Omicron, provided their structure is such that they target multiple proteins for detecting on the virus body. So if there is a PCR or other test which only, say, aims at one single protein which is specific to Delta, and there are actually some tests in the market for that, and US FDA has actually prescribed 2 such tests that they cannot be used any longer for detection of viruses, because they only could detect Delta. But the majority of tests in the market, because there is a very, if I can say technically, there is a particular gene deletion in Omicron, which is not there in the spike protein of Delta, and that is very specifically picked up by all the tests. So same test, if one test is showing no gene deletion, that is Delta, and if the other test is showing gene deletion, that is Omicron. So it is pretty simple for the scientists and the doctors to know whether it is Delta or Omicron, but since it does not affect the course of treatment and what the patient has to do at home, if there are symptoms of COVID, it does not matter. It is mainly for scientific research purposes that we have to know. And maybe if we know that this is Omicron, maybe there is a little bit of reassurance that this is going to be mild. But like I said, this virus is very treacherous. If you have comorbidities, and if you have like a very unique immune system, that you're going to react to this virus in a very different manner than other people, Omicron is as dangerous. So number of deaths has not actually come down during the peak of Omicron because of sheer numbers. And people are landing up in hospitals in huge numbers, which is more than what we saw in Delta in US. But most of those infections are actually incidental infections. Let me touch a little bit on that. Means you go to the hospital for some other problem, say chest pain. And then you get tested in the hospital and you're also COVID positive. So people actually, 50% of people in those who are going to the hospital and being detected as COVID positive are those who are going to the hospital for some other disease and getting detected as COVID positive. Means this virus, this current Omicron epidemic is largely asymptomatic, but the spread, like I said, is not stopped by either previous infection, previous immunity, either through vaccination or through previous infection or vaccination or by other means. So all the tests do detect Omicron, but the patient need not know.
Thank you, Dr. Daswal. You mentioned that hospitalization in the US is going up severely than the hospitalization cases in India, as we saw during the second wave. What could be the particular reason behind hospitalization? Is it this hospitalization because of the incidental infections that you're talking about, or on account of COVID? And then why? And why is the difference in hospitalization cases?
There are various reasons for that. I have tried to look at why hospitalizations are up. First, people are more aware. So they are going to hospitals even when they start like symptoms. With symptoms, they do not need hospitalization. Doctors are more cautious. Second thing is this disease is manifesting more in children. And with children, we do not take chances. So parents are rushing to the hospitals and doctors, pediatricians are admitting those children for follow-up and not releasing them. Although again, the disease has stayed mild in the children, but since the child population is now the population which is not vaccinated, and the virus doesn't care whether you're a child or an adult, it needs a host to propagate. So more children are falling sick in this wave because of their unvaccinated status. And again, at a matter of caution, more hospitalizations are there. But now the graph in most of the states in the US has started coming down, and infectivity rates are coming down and the wave is subsiding. So that is a positive thing. But Dr. Fauci has said that in this wave, we do not have to look at the number of cases. We actually have to look at the number of severe cases and deaths, and which are definitely less than what was there in Delta. But again, because the numbers are more, of course, the death numbers remain staggering too. I mean, so many people, the extra deaths like we call are there everywhere around the world.
So can we say that the deaths due to comorbidity and COVID in the second wave, the same thing can be witnessed if there is comorbidity in case of the third wave or this current wave? Or this will be, in this case, comorbidity factor will be a lesser factor than in the second wave? Can that be said, or it is too premature to say that?
I would not be able to say that because I do not have the data for that. But one thing I can say for sure is that vaccination booster has shown to be very effective in people with comorbidities in preventing severe disease and hospitalization. So getting boosted for people with comorbidities is more essential than other people who do not have them, because vaccination has proven to be very, very effective among this population as well.
To this question of vaccination is something which is being asked by people everywhere. I understand that there is an increase in the number of cases of COVID in which the person concerned was already vaccinated twice. Now, is it only what could be the reasons apart from one being callous? I mean, I would assume that somebody is callous, then he is or she will not go scot-free as far as the infection is concerned. But is there a medical reason why if somebody is vaccinated fully and then he or she gets COVID again, what could be the reason behind that?
Omicron is spreading through immune evasion. So vaccination, what does vaccination do? It gives you certain antibodies so that when there is a new similar infection, the existing antibodies attack that new infective agent and neutralize it. The existing antibodies, which are made with the vaccines given, do not detect Omicron with 2 doses. So that is how, so it is not about your callous attitude, or it's not about your vaccination status or previous infection status. Omicron evades the immune response in the body, which is pre-established through various mechanisms. But the good thing is that Omicron likes to stay in the upper airways and does not move to the lower airways. So it is still being studied whether it is because of the existing immunity or whether it is the nature of the Omicron to infect the upper airways and not cause pneumonia and ARDS of Delta. But vaccination, like I said, does not prevent reinfection in COVID, even in Delta. So even if you're vaccinated, you can get reinfected with Delta. What it prevents is hospitalization and severe diseases. So there is a distinction between getting infected, becoming symptomatic. That can happen despite vaccination and previous infections because this virus is capable of doing that. But you can stay asymptomatic, you can become asymptomatic, but if you're vaccinated, you are 90% or more less likely to get severe disease, and you're 90% or more less likely to be hospitalized for COVID. So that is where the vaccinations work, not before that.
Certainly save you from getting COVID infection again. But the severity or hospitalization or any other major cases, that can be reduced to some extent if you are fully vaccinated. I mean, that's what we understand. These are the questions which are.
Dr. Mitra, I would like to correct you.
Dr. Mitra, madam, I'm here to do my PhD, so everybody calls me Dr. Mitra. I don't know why. They have been very kind, including you.
It's just a matter of habit for me because I'm mostly with doctors. But you will soon be doctor. But I have to correct you here. It's not some protection. It's huge protection. It's huge protection. So it's 95%, 96%, 99%. So we cannot say some protection. Getting vaccinated and boosted gives you huge protection. So you can rely on that.
These restrictions in the UK being relaxed or withdrawn, I mean, is there something social aspect behind it, or they are giving a message to the Britishers or to people that do not worry beyond a point?
I think Dr. Raghi is the expert to answer the political economy of the epidemic or the pandemic. But of course, policy making is a very complicated. It is as complicated as the mutations on the surface of coronavirus. I'm a policymaker myself, but I would not hazard a guess here. But people need reassurance. And I think giving them reassurance in a manner when the populations are 100% vaccinated, and there's hardly anything for the governments to do except to maintain COVID appropriate behaviors and watch the pandemic curves, how they are moving. We can always reassure our people that you are now free to resume your activities because most of the world has done it, whether the governments have said so or not explicitly, because people cannot be kept inside their homes for such a long period of time. So even during the Delta wave, people were up and about. There were a lot of choices. People were already exercising. So what the governments are here now are doing are just reassuring their populations. But like I said, unlike India, where in Europe, most of these Western European countries, you cannot mandate people on vaccination or declaring their status constitutionally. It's against constitution. But despite that, many European countries have gone ahead, like Italy, and mandated vaccinations for their workforce, because this pandemic is an entirely different ballgame altogether. So the existing policy paradigms and existing frameworks may not work in tackling with that, but of course the governments have to balance with the established protocols, how their citizenry, has taken the government. Like in US, we see almost 40% people not getting vaccines because they think it is a matter of right for them to decide whether to get vaccinated or not. But the pandemic doesn't care about your rights. It will come to you if you're not vaccinated. So I think there's a lot of complexity. I would not like to comment any more on this. It could be premature, or it could be the right decision. Nobody knows about the future of the COVID as of now. We can be hopeful only if we get fully vaccinated. And most of these countries who are withdrawing restrictions are highly vaccinated. So are there any other questions, or am I not able to?
I'm sorry. I in fact, there is a question, ma'am, from Mr. Amrinder Singh in the chat box. I'm unable to really understand. He says, please tell us how to react to administrative issues. Then he goes on to write that his elder brother had tested negative in rapid test in last April. Then the RT-PCR test result came after 10 days in Bihar. And then after his brother had expired. I mean, I understand from his language, if Mr. Amrinder Singh is still around, it'll be better if he asks the question and unmutes himself.
Yeah.
Amrinder ji, you are amongst us? हाँ, तो ऐसा है कि आप ना अपना सवाल जो है, you can ask this question to Dr. Raswal straight away.
Yes, ma'am. Myself, Amrinder Singh, I have done social medicine, so MPhil in social medicine, and in fact, I want to. Madam is here or she left?
Yeah, madam is listening to you carefully.
मैं आपकी बात सुन रही हूँ और आप मुझे
जी मैम, तो मैं ये पूछ रहा हूँ जी मैम, मैं ये जानना चाहता हूँ कि मेरी पढ़ाई खुद सोशल मेडिसिन में हुई है, पब्लिक हेल्थ में, और तो मैं ये सब होने के बावजूद भी मेरे अपने बड़े भाई को कोविड हुआ था, और आई वांट टू नो द एडमिनिस्ट्रेटिव रीजन, और बिहार में वो थे तो उनका जो टेस्ट आया था वो रैपिड टेस्ट नेगेटिव आया, उसके बाद फिर RT-PCR टेस्ट हम लोगों ने दिया, उसका रिजल्ट इनफैक्ट जब हमने क्रीमेशन कर दिया उसके बाद आया। अब बताइए मैम, इन स्पाइट ऑफ द फैक्ट दैट आई एम एजुकेटेड पर्सन, हाउ टू रिएक्ट विद दिस एडमिनिस्ट्रेटिव इश्यूज? 10 दिन के बाद RT-PCR का क्या किया जाए? आप मैम हार्वर्ड से कर रही हैं PhD, तो आप बताइए, और आप IAS ऑफिसर भी हैं मैम, तो आप बताइए ये इस टाइप का एडमिनिस्ट्रेटिव और केयरलेस एटीट्यूड कैसे इसको हैंडल किया जाए मैम? थैंक यू।
मुझे बहुत अफसोस है आपके भाई के बारे में सुनकर। I'm really extremely sorry that happened. देखिए, मैं बिहार के बारे में तो कुछ कमेंट कर नहीं पाऊंगी, और मुझे ये जानकारी नहीं है कि आपके जो स्वर्गीय भाई हैं उनको कब इन्फेक्शन हुआ था, और
अप्रैल में मैम, लास्ट अप्रैल, सेकेंड वेव में मैम। सेकेंड वेव का एक्चुअली हाँ मैम, मैं खुद पब्लिक हेल्थ से हूँ, तो मैं बहुत ध्यान से ये सब न्यूज देखते रहता था, गवर्नमेंट को फॉलो। मैम पता ही नहीं चला सेकेंड वेव आया कब, और मेरे पूरी फैमिली, मेरे बड़े भाई मुजफ्फरपुर में रहते थे, मेरे छोटे भाई छपरा में रहते थे, मेरी बाकी फैमिली लखनऊ में रहती थी, सभी लोग एक साथ पॉजिटिव हो गए थे। मैम समझ ही में नहीं आ रहा था कि हुआ क्या है, गवर्नमेंट की तरफ से कुछ नहीं पता चला कि हुआ कैसे, और सेकेंड वेव में सब लोग एक साथ पॉजिटिव हो गए।
जी जी जी, वो समय काफी भयानक था हमारे सारे सिटीजन्स के लिए, क्योंकि सच में ही हम उस समय प्रिडिक्ट नहीं कर पा रहे थे, क्योंकि कोविड के बारे में हमें उतनी जानकारी नहीं थी जितनी आज है। कि और भारत में अनफॉर्चुनेटली काफ़ी थ्योरीज उठ रही थी कि इंडियंस को कोविड नहीं होता है, हम लोग इम्यून हैं क्योंकि हमारे को ट्यूबरकुलोसिस होता है, BCG वैक्सीन्स लगी हैं इसलिए नहीं होता है, जिसका कोई साइंटिफिक बेसिस नहीं था। और जैसे हमारे भार्गव मित्रा जी कह रहे थे कि लोग साइंटिफिक सोर्सेज के बजाय व्हाट्सएप से जानकारी लेना पसंद करते हैं। मैं ये नहीं कह रही कि आपके परिवार ने ऐसा किया होगा, ये कुछ मैं जनरल जो उस समय, क्योंकि मैं भी बात करती थी, मेरी अपनी बहनों को, मेरे परिवार में मेरे माता पिता सबको कोविड हो गया था उस समय, और हमारे मतलब प्राण पूरे सूख चुके थे, क्योंकि मैं यहाँ से आ नहीं सकती थी। और मैं जान सकती हूँ कि उस समय आपकी स्थिति क्या होगी, कि आपको पता नहीं चल रहा है कि क्या होगा। और उस समय हमारे पास इतने टेस्ट, इतने पीपी किट्स, इतने हॉस्पिटल में ऑक्सीजन और ये सब नहीं थे। तो उस समय जो भी जिनके साथ भी ये घटना घटी है वो बहुत अनफॉर्चुनेट है। और मैं यही उम्मीद कर सकती हूँ कि भविष्य में हमारी तैयारी अब ऐसी है कि अब वैसी कोई वेव आने से हम ज़्यादा से ज़्यादा जान बचा सकेंगे। और उसके साथ ही मैं इस बारे में, मुझे बहुत खुशी है अमरिंदर जी कि आप सोशल मेडिसिन में हैं और आप मुझसे पूछ रहे हैं कि आप क्या कर सकते हैं। आप बहुत कुछ कर सकते हैं।
हार्वर्ड स्कूल ऑफ मेडिसिन में हमारे क्लासमेट्स पढ़ रहे हैं, PhD कर रहे हैं। तो हाँ
जी, तो आप बहुत कुछ कर सकते हैं, क्योंकि ये बीमारी गवर्नमेंट के कंट्रोल से नहीं आने वाली है। ये बीमारी लोगों के संयम से, और जो मास्क पहनना है, जो डिस्टेंस, और जरूरी अगर नहीं है तो बाहर नहीं जाना है, पिक्चर देखने अभी तो बिल्कुल नहीं जाना है, मॉल में फालतू शॉपिंग करने नहीं जाना है। तो आप सोशल मेडिसिन में हैं, आप जिस एरिया में रहते हैं, आप ये जागरूकता जरूर, आप भुक्तभोगी हैं, आप और भी अच्छे से लोगों को समझा सकते हैं अपना पर्सनल एग्जाम्पल से कि हमें ये सब चीजें पालन करनी है। गवर्नमेंट लोगों को जेल में डाल सकती है लेकिन वायरस को जेल में नहीं डाल सकती है। तो आप तो बहुत ही, यू आर द राइट पर्सन टू स्प्रेड दिस मैसेज अक्रॉस, और आप ये जरूर बताएं। जी जी, धन्यवाद, जरूर कीजिए।
जी मैम।
Well, in fact,
thank you.
As you were talking, Dr. Uday, who had asked 2 questions from Dr. Nishal earlier, has just posted a question for you. He says that you had mentioned that the best way would be to get everyone vaccinated. Then he goes on to ask, does everyone include newborn children also? And he asks, are kids of up to certain years of age safe enough? So if you could respond to that.
You would know the answer to this very soon, क्योंकि US में जो है ट्रायल्स चल रहे हैं। US में 5 साल से ऊपर के सब बच्चों के लिए तो वैक्सीन आ चुकी है। और जैसे मैंने बोला कि वायरस को कोई फर्क नहीं पड़ता है कि आप बच्चे हैं या बड़े हैं, उसको तो एक होस्ट चाहिए। और फॉर्चुनेटली बच्चों में बेशक ये ज़्यादा सिम्टोमेटिक बीमारी नहीं करता है, लेकिन बच्चे इसको बहुत ज़्यादा फैला सकते हैं, क्योंकि वो उनका जो जोग्राफिक रेंज होता है, स्कूल जाना है, फ्रेंड्स के घर जाना है, बर्थडे पार्टीज में जाना है, तो वो बीमार नहीं पड़ने के बावजूद भी इसको बहुत ज़्यादा फैला सकते हैं। तो 5 साल से छोटे बच्चों के लिए अभी क्लिनिकल ट्रायल्स चल रहे हैं। वैक्सीन तो सबको ज़रूरत पड़ेगी, लेकिन उसकी सेफ्टी और एफिकेसी का डेटा जैसे ही आएगा वैसे ही बच्चों को भी इंजेक्शन लगना शुरू हो जाएगा। और आप अगर दूसरा प्रश्न मुझे फिर से याद कराएं प्लीज।
दूसरा प्रश्न ये था कि does it it talked about newborn, कि does it also include newborn? Are kids of up to certain years of age they are safe?
No, बिल्कुल नहीं, बिल्कुल नहीं। हमें बच्चों को बहुत बचा के रखना है। जैसे मैंने बोला, ये सबको अगर होगा तो बहुत सारे लोग बीमार पड़ेंगे, उसी तरह बहुत सारे बच्चे बीमार पड़ेंगे। और अभी हमारे पास एक लेटेस्ट स्टडी है जिसमें ये बताया गया है कि जिन बच्चों को कोविड होता है सीवियर, उनमें डायबिटीज होने का चांस 5 से 6% ज्यादा पाया गया है। और ये तो एक डेफिनेटिव, CDC ने अपनी वेबसाइट पे स्टडी को रिलीज किया है कि हम शॉर्ट टर्म में कोविड की बात करते हैं, लेकिन कोविड का एक दूसरा रूप है जिसको हम लॉन्ग कोविड बोलते हैं, जो आपके अंदर आता है और रह जाता है। जैसे चिकन पॉक्स आपके अंदर आया, उसने चिकन पॉक्स किया, लेकिन कई सालों के बाद वो एक दूसरी बीमारी करता है, शिगेला जिसे बोलते हैं। उसी तरह से ये वायरस अगर अंदर बैठ जाता है तो ये धीरे धीरे बॉडी के कई ऑर्गन्स को डैमेज करता है। तो अनफॉर्चुनेटली हमने ये देखा है कि जिन बच्चों को कोविड हुआ है उनमें डायबिटीज होने का जो चांस है वो काफी बढ़ गया है। 5 से 6% ज्यादा बच्चों में डायबिटीज हो रहा है। और चूंकि अभी कोविड के बारे में हम सब कुछ नहीं जानते हैं, तो प्रिवेंशन is the best policy. कोई भी इस कोविड से, शॉर्ट कोविड या लॉन्ग कोविड से किसी तरह की इम्यूनिटी आप क्लेम नहीं कर सकते हैं, किसी तरह की सेफ्टी नहीं कर सकते हैं। सेकेंड वेव का एग्जाम्पल हमारे सामने है कि हमने ज्यादा ध्यान नहीं दिया तो क्या हुआ। तो ध्यान तो अभी हमें कुछ सालों तक हम नहीं हटा पाएंगे। धन्यवाद।
Thank you, Dr. Daswal. Ladies and gentlemen, on that note, we will, I think our speakers have spoken on the matter. And I'll have a very quick recap of a couple of observations made by our esteemed panelists. Dr. Professor T.P. Lakhane, he spoke about centrally controlled electronic medical record system, which is very important to track all these issues. Proper teaching to the nursing staff and technicians, and as well as to the PG doctors. The role of PG doctors and interns also was mentioned by him. He spoke about learning from our mistakes and favored the growth of GDP percentage for healthcare and empowerment of medical staff. Dr. Nishal was very clear and pragmatic about how we are handling it at this moment. And he also mentioned, as Dr. Daswal was speaking, I brought up the issue of infodemic. And panic creation is something which he was insistent upon, that, this is something which has taken a huge toll on our lives. And this issue has been brought about by many speakers. And this is something which is highly talked about. That he also generally mentioned that it is spreading very fast. The lethal aspect of COVID, of Omicron is yet to be established, but one has to be very careful. And as Dr. Daswal also rightly mentioned, that it creates problems more for the upper larynx and pharynx in those areas than it has gone down, which was the case with the Delta variant. And lifestyle improvement is something which Dr. Nishal was speaking especially about, and I think it's a very important thing. We need to kind of look after ourselves. We always look for some solace outside our own self, and we always expect the system or the environment to take care of us instead of we taking care of ourselves. And I believe that most of the infections which have been created or which have actually affected us, they have happened because of some of the lax approach that we have generally towards any precaution. We do not like precautions. I mean, at the individual level, we do not want to take medicines. We do not want to take precautions. We do not want to listen to the doctors. We are self-doctors. We are experts in everything. We are very good at giving advices, and we are very poor in following them. We are very good in spreading messages. We do our PhD in forwards on WhatsApp. But, this has created more trouble for us, in fact, and we have been shown very poor light on these counts. And I do not deal with this area. I'm a diplomat, but Dr. Daswal will bear out. And Dr. Nishal also mentioned it very rightly. And I think Professor Lakhane or Dr. Professor Khilani mentioned, I believe that we did quite well as compared to many, many countries. I mean, we are asked this question abroad. I just put a simple thing in front of them that, we have a population of 1.3 billion, which is much more than many, many countries put together. And if you look at the death rate or the infection rate, naturally, it will be pretty massive because of this country of this magnitude. You have 4 lakh infections, 400,000, which is many times more. So it is also because of the population. Had India had a 30 million or 40 million population in all, as Uzbekistan has where I'm living now. I'm living in the sense I'm on assignment. So its story could have been very different. So it is flawed to connect Uzbekistan or Tajikistan or any other smaller European state with what we have. Our state of infection, our state of deaths, they are incomparable. But still, if you look at that statistics, we have been able to manage it very well. I mean, our COVID management is exemplary, I would say. And not only because of any bias, because I'm a government servant, no, or Dr. Daswal is a government servant. I don't think that is really important. Important is that we have to be realistic about how India has gone about managing its COVID problem. And that is a lesson in itself. And I believe that, someday there'll be researches and someday there'll be papers written on this topic. And I definitely would encourage younger generation. I don't know, don't plan to do my PhD on that topic. I don't have information on that, but somebody someday, Dr. Daswal would be encouraged or should be encouraged to do a research and bring up a paper on how India tackled COVID in real terms. We showed that experience on the ground where everybody's contribution was noticeable and notable, apart from the policy management, which also, I mean, there are a lot of things which go on behind the curtain, which the world is not aware of. It's very easy to show a finger, put a finger to something, that you are erring on this side. We generally are very critical of everything that we have. It's very easy to say कि यहाँ पे इतने लोग मर गए. But वो लोग क्यों मरे, क्या factor है? Nobody goes into those details. I mean, yes, oxygen and all that, we always harp on that. It becomes a political issue. But we must applaud ourselves. The death rate could have been far, far more had the government, had the people in general, had the doctors, and at every level, ordinary people would not have taken certain decisions themselves. And some of them rose to the task, even at the cost of their health, and many have perished, we all know, in the line of duty, I would call it. I mean, there was a discussion that are the army officers only dying in the line of duty? A doctor is also dying on the line of duty. A nurse is also dying in the line of duty. This has been recognized. Our mindset will have to be changed. But then there is nothing like, Dr. Daswal very rightly mentioned, Dr. Nishal had mentioned, Professor Ragi had very rightly mentioned about certain precautions being taken at our levels. We are the masters of our fate. We know that, our lungs is bad. We know our heart is poor. Our liver is not 100%. Many of us would know. We have our medical reports in hand. Still, we do not bother. And we are totally oblivious to the fact that COVID can actually, straight away start affecting these organs and we perish very quickly. Still, the realization is very less. I just hope, and we all hope, in fact, that at least those who are enlightened in courts, they take certain measures about spreading the message, as you, Dr. Daswal pointed out to Mr. Amrinder Singh, that you are an expert or you are specializing in public health. You take certain measures at your level, in your society, in your surrounding. You tell people, if Mr. Amrinder Singh or any of us can actually go around and tell people certain precautions that we need to take, we would do a favor to ourselves. We would do a favor to everybody else. If somebody listens to me and starts putting the mask in the right manner, I'll be glad that I have done one simple, important thing today, that I have shown that these are the 8 ways of not wearing a mask. For not wearing a mask, this is how you should put a mask. So some of the most enlightened people put the mask in every place than the place that it is supposed to be on your face. So what to tell those people? So I think, this has been a very enlightening conversation. And Dr. Daswal, I believe that, there's no harm in doing a double PhD. You are a doctor, but I believe that you are a medical doctor. Probably there's always a case for being a doctorate. And write about India's tryst with COVID, like with India's tryst with destiny, and how we actually managed it. The generations to come, they will read this book and they will draw lessons from it. So I would really hope that, they let the process start with Dr. Daswal. Someday she might write a book and I'll be the first one to kind of, buy it. You can let us know. So thank you so much for taking some time out. Thanks to all the speakers who took time out and they spoke from the heart. And the audience that is present here, they listen to some extremely wise advice. At times we know a lot of things, but you concretize the whole matter. You put them in perspective. That's something which is huge. So there are a lot of takeaways. And before we close, we have Dr. Mahip with a word of thanks. So if Dr. Mahip can switch on his video, and you please go ahead. Dr. Mahip, the floor is yours for a vote of thanks. Thank you so much.
Thank you, sir. Thank you so much. I stand before you as the convener of this webinar to extend a vote of thanks to all of you and acknowledge your presence. On behalf of Alumni Association of JNU, at first, let me acknowledge the significant contribution to our knowledge partners in this event, GRC India, BRICS Chambers of Commerce and Industry, Services Export Promotional Council, SEPC, and the Policy Times. I would like to pay earnest gratitude to all the distinguished speakers and dignitaries to deliberate and share their findings, ongoing research, scope and limitations, challenges and opportunities, effectiveness of vaccine, treatment options, preventive measures for COVID-19, and its socio-cultural, psychological impact as well. In fact, AJ considers it privilege that eminent scientists, social scientists, researchers, and clinicians from India and abroad have joined this AJ webinar and shared their first-hand experience of the hospital, in the laboratory, their findings direct from their field research, as well as behavioral changes and psychological effect being quarantined at home or secluded in the hotel room. Our speakers list is both wide, very vast, and varied, draw from across Bharat and abroad, researching in collaboration. The entire session was based on comprehensive knowledge, nuances of quality and in-depth research, scientific temper, and rational with unique vantage point with the various perspectives. It was brilliant, outstanding, and extraordinary session, lots to learn and pursue more advanced research. I pay sincere gratitude to the chief coordinator of this program, Sri Krishnanand Maharaj sir, who managed everything possible to make this program possible in such a short span of time and introduce the theme of today's webinar also. Our special thanks to Honorable Padam Shri Professor T.P. Lahane sir, who despite his hectic work schedule spared time for us and addressed the gathering as we met today for the 30th edition of AJ webinar series on COVID-19, OMICRON and looming crisis, how to handle it. Our webinar is important in the context while the entire globe has been reeling under the COVID-19 pandemic for almost 2 long years by series of its variants, one by one, and every time new challenges popped up for the entire ecosystem as well as biosphere. This academic deliberation made at this AJ platform would surely be useful for the health of our nation and inspire our young scientists, doctors, social scientists, and researchers to undertake more and more research and development to ensure all of us the state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. We are highly indebted to the JNU administration that always stood by us, and we are highly obliged to our alma mater. We are grateful to all the faculty members of JNU who joined us, especially Professor Praveen Kumar Verma sir, who played the pivotal role as the moderator of this webinar and performed his task so brilliantly. It's very impressive, much appreciated. On behalf of the organizing team, I would like to pay highest gratitude to our star speakers of today's webinar, Dr. Mrinali ma'am, Dr. Neeraj Nishchal sir, Dr. GC Khilnani sir, Professor BK Singh sir, for sharing their ideas and thoughts, vista and vision on the pertinent theme of today's webinar. We are truly thankful to our speakers for answering all the queries of our participants in the great details and looking into all the aspects. We really owe you all immensely. I would like to express my heartfelt gratitude to our most honorable and reverend Honorable Bhargav Mitra sir, who gave his consent readily to continue moderation task of the program after Professor Praveen sir, who left for another webinar. Thank you so much, sir, for engaging the question and answer session also very amicably and summarizing the entire session in your valedictory address. We are truly indebted to you for managing time from your impossibly busy schedule in the service of our nation overseas. It's extraordinary commitment for our Alumni Association. I would like to express my sincere gratitude to all the participants who logged in from across the globe to join this webinar, including our alumni and life members, friends and well-wishers, and all EC members, many of whom joined it on Facebook, YouTube, Instagram, and other multimedia platforms to listen to the brilliant speakers who are leaders in their respective domain. Friends, you all will be happy to know that we got fantastic technical support by Sri Biju Phillips sir and his team, including our assistant manager, Mr. Satan Rawat, who worked around the clock to make our 30th webinar session a grand success. On behalf of Alumni Association of JNU, I would like to extend a big thank to आज इसी team under the able leadership and guidance of the President Sri Rajesh Kumar sir and our General Secretary Dr. Dheeraj Kumar Singh sir, who despite their respective preoccupations did everything possible to make our Aaj webinar series a regular hangover platform for the most meaningful discussions on topics of national interest. I would like to end on an optimistic note that our next webinar session would be announced shortly, as well as are fully geared up and motivated to it quite frequently. I have a request to all JNU alumni participants. Please add a special feather in your cap by being life member of Alumni Association of JNU. It will be so exciting. Kindly visit our website www.jnualumni.com. You may write to us aajjnu1 @jnu1@gmail.com, or you may call us +91 9911 963456. Alumni Association of JNU wishes you all a happy and corona-free living ahead. Thank you so much for your participation. Jai Hind.
Thank you so much.
Mahim, thank you so much for your kind words towards me and your acknowledgement of how well this seminar has been organized and how well these speakers have dwelt upon the issue at hand. Ladies and gentlemen, we have come to the final stage of our webinar, which will be the national anthem. So I would request the national anthem to be played and everybody may kindly stand.
भारत भाग्य विधाता पंजाब सिंह गुजरात मराठा द्राविड़ उत्कल बंगा विंध्य हिमाचल यमुना उच्छल जलधि तरंग तव शुभ नाम जागे तब शुभ आशीष मांगे गाहे तव जय गाथा जन गण जय 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 हे
Thank you, ladies and gentlemen. Let me have the opportunity and pleasure to wish you all safe times. Let your lives be safe. Let your near and dear ones be safe. Precaution is the byword. Thank you all for joining this webinar and looking forward to more interactions. Thank you so much and good night.
Thank you.
Namaskar to everyone. Namaskar to everyone.
Namaskar.
Thank you, Dr. Daswal. Thank you, everybody who has joined.
Thank you, Dada.
Thank you so much.
बहुत बहुत धन्यवाद ज्वाइन करने के लिए मैम. Thank you so much.
नमस्ते मैम. नमस्ते सर.
नमस्ते.
प्रणाम सर.
नमस्ते, बहुत बहुत धन्यवाद. प्रणाम.
Kutisha Dhanyavad from Thailand.
Wish you all the best.
All the best, Dr. Uday. All the best.
Thank you, Dada. Thank you, Dada.
Thank you, Dada.
Thank you. Thank you, Dheeraj. Thank you so much.
सबसे बड़ी आपने बहुत अच्छा मॉडरेट किया. वेरी गुड. एक्सीलेंट सर.